habits para sa healthy Pilipinas.
Saybay handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Do it na yan, kalusugan ay unahin at mga nahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Di sinasaktan, pinoprotektahan. Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety over land over sea. See? Ligtas at malakas.
Do it na yan, kalusugan ay unahin at mga nahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Bawal na usok sa atin, baka ako hikain, di nakakagala ang bisyo.
Hi, how can I help you? Dito na tayo sa kakaibang high. GV sa Bishop Lifestyle.
Do it na yan, kalusugan ay unahin at mga nahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Sa mundong ginagalawan, pagandaan ng big one. Kamay, sa sakit, sa isip sa gawa. Leave nothing but footprints.
Kalusugan ay unahin at mga nahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas.
Masarap mangarap para sa iyong pamilya. Si Junior, magiging doktor. Si May, magiging engineer. At si Paolo, magiging sikat na chef. Di ba magandang makita mo silang lumaki? Ang kinabukasan nila, nagsisimula sa araw-araw mong pag-iingat. Magsuot ng helmet.
Seven healthy habits para sa healthy Pilipinas.
Pag-ibig ang panalo, one love, isang uri, papugay at papuri, walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Do it na yan, kalusugan ay unahin at mga nahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Huwag nang magulat sa kumakalat, matay inulat sa tamang ulat. Ang dapat babakunahan na, mahalaga na bata pa kahit matatanda. Bakuna muna, una sa lahat.
Yeah! Do it na yan, kalusugan ay unahin at mga nahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Galaw-galaw, baka ma-stroke. Like, bike, jog, jump, rope. I'm so kumain ng sapat, dapat balance. Kahit pinggang Pinoy, manami. There you have it, isa sa 7 healthy habits. Sundin!
Do it na yan, kalusugan ay unahin at mga nahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulan
vaccinated.
Don't smoke, lessen alcohol, say no to drugs.
Care for yourself, care for others. Practice safe sex.
Do no harm, put safety first.
Do it na yan. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Sa mundong ginagalawan, pagandaan ng big one. Kamay, sakit, sa isip sa gawa. Leave nothing but footprints.
Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Huwag nang magulat sa kumakalat, matay inulat sa tamang ulat. Ang dapat babakunahan na, mahalaga na bata pa kahit matatanda. Bakuna muna, una sa lahat.
Yeah! Do it na yan! Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Bawal na usok sa atin, baka ako hikain, di nakakagalak ang bisyo.
Hi, how can I help you? Dito na tayo sa kakaibang high. G-Visa Vision Free Lifestyle.
Do it na yan! Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Saybay handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Do it na yan! Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Pag-ibig ang panalo, one love. Isang uri, papugay at papuri. Walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Di sinasaktan, pinoprotektahan. Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety over land over sea. See? Ligtas at malakas.
Do it na yan! Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Galaw-galaw baka ma-stroke like bike, jog, jump, rope. I'm so kumain na sapat, dapat balance side. Pinggang Pinoy, malami. There you have it. Isa sa 7 healthy habits, sundin.
Do it na yan! Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Move more, eat right,
Be clean, live sustainably.
get vaccinated.
Don't smoke, lessen alcohol, say no to drugs.
Care for yourself, care for others.
Practice safe sex.
Do no harm, put safety first.
Do it na yan! Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Saybay handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Do it na yan! Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Di sinasaktan, pinoprotektahan. Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety over land over sea. See? Ligtas at malakas.
Do it na yan! Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong healthy habits para sa healthy Pilipinas.
Bawal na usok sa atin, baka ako hikain, di nakakagala ang bisyo.
Hi, how can I help you? Dito na tayo sa kakaibang high. GV sa Bicol CHD Lifestyle.
Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Sa mundong ginagalawan, pagandaan ng big one. Kamay, sa sakit, sa isip sa gawa. Leave nothing but footprints.
Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa healthy Pilipinas.
Masarap mangarap para sa iyong pamilya. Si Junior, magiging doktor. Si May, magiging engineer. At si Paolo, magiging sikat na chef. Di ba magandang makita mo silang lumaki? Ang kinabukasan nila, nagsisimula sa araw-araw mong pag-iingat. Magsuot ng helmet.
Seven healthy habits para sa healthy Pilipinas.
Pag-ibig ang panalo, one love, isang uri, papugay at papuri, walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Huwag nang magulat sa kumakalat, matay inulat sa tamang ulat. Ang dapat babakunahan na, mahalaga na bata pa kahit matatanda. Bakuna muna, una sa lahat.
Yeah! Do it na yan! Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Galaw-galaw, baka ma-stroke like bike, jog, jump, rope. I'm so kumain ng sapat, tapat balance. Kahit pinggang Pinoy, manami. There you have it, isa sa 7 healthy habits. Sundin!
Do it na yan! Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na go.
Move more, eat right,
Be clean, live sustainably.
get vaccinated.
Don't smoke, lessen alcohol, say no to drugs.
Care for yourself, care for others.
Practice safe sex.
Do no harm, put safety first.
Do it na yan!
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Sa mundong ginagalawan, pagandaan ng big one. Kamay, sa sakit, sa isip sa gawa. Leave nothing but footprints.
Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Huwag nang magulat sa kumakalat, matay inulat sa tamang ulat. Ang dapat babakunahan na, mahalaga na bata pa kahit matatanda. Bakuna muna, una sa lahat.
Do it na yan. Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito, sa healthy habits go na go.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Bawal na usok sa atin, baka ako hikain, di nakakagala ang bisyo.
Hi, how can I help you? Dito na tayo sa kakaibang high. G-Visa Bicol CHD Lifestyle.
Do it na yan. Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito, sa healthy habits go na go.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Saybay handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Do it na yan. Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito, sa healthy habits go na go.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Pag-ibig ang panalo, one love. Isang uri, papugay at papuri. Walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Do it na yan. Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito, sa healthy habits go na go.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Di sinasaktan, pinoprotektahan. Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety over land over sea. See? Ligtas at malakas.
Do it na yan. Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito, sa healthy habits go na go.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Galaw-galaw, baka ma-stroke like bike, jog, jump, rope. I'm so kumain ng sapat, dapat balance. Side pinggang Pinoy, malami. There you have it. Isa sa 7 healthy habits, sundin.
Do it na yan. Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito, sa healthy habits go na go.
Move more, eat right,
Be clean, live sustainably.
Get vaccinated.
Don't smoke, lessen alcohol, say no to drugs.
Care for yourself, care for others.
practice safe sex.
Do no harm. Put safety first.
Do it na yan.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Saybay handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Do it na yan. Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito, sa healthy habits go na go.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy
Di
Pilipinas.
sinasaktan, pinoprotektahan. Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety over land over sea. See? Ligtas at malakas.
Do it na yan. Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito, sa healthy habits go na go.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Bawal na usok sa atin, baka ako hikain, di nakakagala ang bisyo.
Hi, how can I help you? Dito na tayo sa kakaibang high. G-Visa Bicol CHD Lifestyle.
Do it na yan. Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa uladong ang pitong ito, sa healthy habits go na go.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Sa mundong ginagalawan, pagandaan ng big one. Kamay, sa sakit, sa isip sa gawa. Live na
Masarap mangarap para sa iyong pamilya. Si Junior, magiging doktor. Si May, magiging engineer. At si Paolo, magiging sikat na chef. Di ba magandang makita mo silang lumaki? Ang kinabukasan nila, nagsisimula sa araw-araw mong pag-iingat. Magsuot ng helmet.
Seven healthy habits para sa healthy Pilipinas.
Pag-ibig ang panalo, one love, isang uri, papugay at papuri, walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Hindi mo na kaya, ako na.
Healthy habits para sa healthy Pilipinas.
Huwag nang magulat sa kumakalat, matay inulat sa tamang ulat. Ang dapat babakunahan na, mahalaga na bata pa kahit matatanda. Bakuna muna, una sa lahat.
Yeah! Do it like yan. Kalusugan ay unahin at mga nahin ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Sa mundong ginagalawan, pagandaan ng big one. Kamay, sakit, sa isip sa gawa. Leave nothing but footprints.
Kalusugan ay unahin magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits, go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Bawal na usok sa atin, baka ako hikain, di nakakagalak ang bisyo.
Hi, how can I help you? Dito na tayo sa kakaibang high. G-Visa Bicol CHD Lifestyle.
Duwit na yan, kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits, go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Di sinasaktan, pinoprotektahan. Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety over land over sea. See? Ligtas at malakas.
Duwit na yan, kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits, go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Sabay handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Duwit na yan, kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits, go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Galaw-galaw baka ma-stroke like bike, jog, jump, rope. I'm so kumain ng sapat, dapat balance side. Pinggang Pinoy, malami, there you have it. Isa sa 7 healthy habits, sundin.
Duwit na yan, kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits, go na go.
Move more, eat right, be clean, live sustainably.
Get vaccinated.
Don't smoke, lessen alcohol, say no to drugs.
Care for yourself, care for others.
Practice safe sex.
Do no harm, put safety first.
Duwit na yan.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Pag-ibig ang panalo, one love. Isang uri, papugay at papuri. Walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Duwit na yan, kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits, go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Galaw-galaw baka ma-stroke like bike, jog, jump, rope. I'm so kumain ng sapat, dapat balance side. Pinggang Pinoy, malami, there you have it. Isa sa 7 healthy habits, sundin.
Duwit na yan, kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits, go na go.
Move more, eat right, be clean, live sustainably.
Get vaccinated.
Don't smoke, lessen alcohol, say no to drugs.
Care for yourself, care for others.
Practice safe sex.
Do no harm, put safety first.
Duwit na yan.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Sa mundong ginagalawan, pagandaan ng big one. Kamay, sa sakit, sa isip sa gawa. Leave nothing but footprints.
Duwit na yan, kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits, go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Huwag nang magulat sa kumakalat, matay inulat sa tamang ulat. Ang dapat babakunahan na, mahalaga na bata pa kahit matatanda. Bakuna muna, una sa lahat.
Yeah! Duwit na yan, kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits, go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Bawal na usok sa atin, baka ako hikain, di nakakagalak ang bisyo.
Hi, Dito na tayo sa kakaibang high. GV sa Bicol Lifestyle.
Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Sa iba'y handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Do it na yan. Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Pag-ibig ang panalo, one love. Isang uri, papugay at papuri. Walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy
Di
Pilipinas.
sinasaktan, pinoprotektahan. Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety over land over sea. See? Ligtas at malakas.
Do it na yan. Kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa healthy Pilipinas.
Masarap mangarap para sa iyong pamilya. Si Junior, magiging doktor. Si May, magiging engineer. At si Paolo, magiging sikat na chef. Di ba magandang makita mo silang lumaki? Ang kinabukasan nila, nagsisimula sa araw-araw mong pag-iingat. Magsuot ng helmet.
Hindi mo na kaya, ako na.
healthy habits para sa healthy Pilipinas.
Huwag nang magulat sa kumakalat, matay inulat sa tamang ulat. Ang dapat babakunahan na, mahalaga na bata pa kahit matatanda. Bakuna muna, una sa lahat.
Yeah! Do it na yan! Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas ang bawat Pilipino sa mundo. Sa ulado ang pitong ito sa healthy habits go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Sa mundong ginagalawan, pagandaan ng big one. Kamay, sa sakit, sa isip sa gawa. Leave nothing but footprints.
Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas ang bawat Pilipino sa mundo. Sa ulado ang pitong ito sa healthy habits go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Bawal na usok sa atin, baka ako hikain, di nakakagala ang bisyo.
Hi, how can I help you? Dito na tayo sa kakaibang high. GV sa Bicol CHD Lifestyle.
Do it na yan. Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas ang bawat Pilipino sa mundo. Sa ulado ang pitong ito sa healthy habits go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Di sinasaktan, pinoprotektahan. Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety over land over sea. See? Ligtas at malakas.
Do it na yan. Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas ang bawat Pilipino sa mundo. Sa ulado ang pitong ito sa healthy habits go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Sa iba'y handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Do it na yan. Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas ang bawat Pilipino sa mundo. Sa ulado ang pitong ito sa healthy habits go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Galaw-galaw, baka ma-stroke. Like bike, jog, jump rope. I'm so kumain ng sapat, dapat balance. Kahit pinggang Pinoy, malami. There you have it. Isa sa 7 healthy habits, sundin.
Do it na yan. Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas ang bawat Pilipino sa mundo. Sa ulado ang pitong ito sa healthy habits go na go.
Move more, eat right.
Be clean, live sustainably.
Get vaccinated.
Don't smoke, lessen alcohol, say no to drugs.
Care for yourself, care for others.
Practice safe sex.
Do no harm, put safety first.
Do it na yan.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Pag-ibig ang panalo, one love. Isang uri, papugay at papuri. Walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Do it na yan. Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas ang bawat Pilipino sa mundo. Sa ulado ang pitong ito sa healthy habits go na go.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Galaw-galaw, baka ma-stroke. Like bike, jog, jump rope. I'm so kumain ng sapat, dapat balance. Kahit pinggang Pinoy, malami. There you have it. Isa sa 7 healthy habits, sundin.
Do it na yan. Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas ang bawat Pilipino sa mundo. Sa ulado ang pitong ito sa healthy habits go na go.
Move more, eat right.
Be clean, live sustainably.
Get vaccinated.
Don't smoke, lessen alcohol, say no to drugs.
Care for yourself, care for others.
Practice safe sex.
Do no harm, put safety first.
Do it na yan.
Para sa healthy Pilipinas.
7 healthy habits para sa healthy Pilipinas.
Sa mundong ginagalawan, pagandaan ng big one. Kamay, sa sakit, sa isip sa gawa. Leave nothing but footprints.
Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Healthy Pilipinas.
Huwag nang magulat sa kumakalat, matay inulat sa tamang ulat. Ang dapat babakunahan na, mahalaga na bata pa kahit matatanda. Bakuna muna, una sa lahat.
Yeah! Do it na yan! Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Bawal na usok sa atin, baka ako hikain, di nakakagala ang bisyo.
Hi, how can I help you? Dito na tayo sa kakaibang high. GV sa Bicol CHD Lifestyle.
Do it na yan! Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Sa iba'y handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Do it na yan! Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa Healthy Pilipinas.
7 healthy habits para sa Healthy Pilipinas.
Pag-ibig ang panalo, one love. Isang uri, papugay at papuri. Walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Do it na yan! Kalusugan ay unahin at mga nahin ng mamamayan ay Healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ang pitong ito. Sa healthy habits ko na to.
Para sa Healthy Pilipinas.
gentlemen, welcome to the Violence and Injury Prevention Alliance Regional Launch. My name is Anthony Ludovice and
I am Miss Hazel.
we will be your host for this morning activity.
Yes.
Kindly settle down, sit back, relax. Marami tayong mga surprises, I believe, and then marami tayong matututunan dito sa activity ito. Alam naman natin na patuloy na dumadami ang mga incident ng viral injuries towards sa mga sasakyan along the road. So, very timely talaga para ma-hit natin, mapababa natin, hindi man natin matanggal, Miss Hazel, yung mga cases sa mga road accidents, at least some through this activity.
Yes. And sa mga nandito ngayon, thank you very much po sa inyong presence. This will not be possible kung wala po kayo. And especially po sa mga organizers, the DOH CHD 5 in cooperation with the Provincial Health Office of Albay.
And of course, Hazel, yung mga stakeholders natin na nandito ngayon, I believe well represented tayo dito. Meron tayo from LTO, from Bureau of Fire Protection,
Yes.
and dealers ng motorcycles, and other riders and cyclists as well. Without much further ado, ladies and gentlemen, we will now proceed to our preliminaries. Please stand up for the opening prayer to be given to us by my dear and beautiful partner, Miss Hazeline Bartolome of the Provincial Health Office. And please remain standing for the singing of the Philippine National Anthem and the Albay Hymn.
So blessed, my Lord, I can see you in all of the things so fine and true. I see you in the beauty of the flowers and the rain. I see you between the lines of the sweet refrain. I'm so blessed, my Lord, I can see you. Even when I'm lonely and in pain, I see you in the beauty of the stars and night. I see you in my life, I see you right. I see you, Lord, in sorrow and in happiness. I see you in the glory of sweet success. I see you, Lord, every hour, every day. I can see you, Lord, whenever I pray. I'm so blessed, my Lord, I can see you in the smile of a baby, sweet and true. I can see you in the eyes of my very best friends. I see you in this face, just like in love that never ends. I see you, Lord, in sorrow and in happiness. I see you in the glory of sweet success. I see you, Lord, every hour, every day. I can see you, Lord, whenever I pray.
kababayan, ang pambansang awit ng Pilipinas.
Okay, so let's all
Please be seated po.
seated. And chillax na. Sige. Okay, so for our opening salvo, we will be having another great performers. So let's welcome on stage and give it a blast to the Optimum Dancers.
Naprotektahan, parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety over see, ligtas at malakas.
Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, 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 time to get off of the road. hands up. Everybody now, let me see your hands up. Right now, hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, 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 time to get off of the road. Hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now, hands up, hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Everybody now, let me see your hands up. Right now.
Yes, there you have it, the Optimum Dancers. A big round of applause, ladies and gentlemen. Grabe, Hayes. Nandun tayo sa backstage, parang napapasayaw ako.
Oh my God, napapaindak ako dun ah.
Umiinit yung ating araw ngayon. For the information ng lahat, ang katabi ko po ay isang Zumba licensed instructor. Kaya,
Thank you,
grabe
Kuya
no?
Franz.
Yes, ladies and gentlemen. So, moving forward, we would like to acknowledge our dear participants. First, we have the Congressman Rog Gutierrez, represented by Attorney Miriam Royce Alsaga, One Rider Party List, Provincial Director. Next is our ever supportive and able, ano pa bang description ko? Handsome, good-looking, lahat na yata, our dear Governor, Attorney Grex Lagman. We have also our board member, I think, board member Victor Ziga Jr. On the way na po siguro siya. And also we have Dr. Estela Zenit, represented by our dear Dr. Dr. Tess Bilarma. I'm sorry.
Regional Director of DOH Bicol CHD, Dr. Ernie Vera. Regional Director of LTO Regional Office 5, Francisco Ranches Jr.
Also, we would like to acknowledge the presence of Senior Superintendent Alberto Di Baggio, Bureau of Fire Protection Regional Office 5. Good morning, sir. Also, we would like to acknowledge Mr. Wawi Villanueva, Bicol Steel Horses, Sir Wawi.
Police Community Presence Commander Brian Palyan, PNP PRO 5. Hello, nandito ba?
Also, we would like to acknowledge Police Colonel Fernando L. Cunanan Jr., Albay Police Provincial Director. Also, we would like to acknowledge the presence of Wilfred Labador of the Head on Operations of Albay EMS, and also Dr. Rosa Maria B. Rempillo, LSSD Chief of the Department of Health, Bicol CHD.
And also Sir Sam Banico, CHD RO5, and Dr. G. Claveron. Hello po.
So mga hindi natin na-mention, siguro provide us names here para ma-acknowledge natin. At this juncture, ladies and gentlemen, may we hear a message from our dear Governor, Attorney Edsel Grex Lagman.
Sinasaktan, pinoprotektahan. Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating.
Thank you, Mr. Ludovice, and of course, to Hazel. Thank you very much. Diyos Marayna Agatabe sa Indugabos, good morning. Today is the first day of June 2023, and on the heels of a very successful Magayon Festival, I think this is one of the best ways to start the month. Na ang sa tuyang isip po, yaon sa road safety, ang sa tuyang isip, yaon po sa prevention of road accidents, and I am very much aware of the fact that the shining lights, so to speak, when it comes to health, when it comes to road safety education, advocacies in Congress, and all the allied men and women who really embark on making the province as safe as possible, yaon po ngunyan na aldaw. And it's only proper and fitting that I acknowledge them once again. So first, I would like to acknowledge the presence of our Regional Director, Dr. Ernie V. Vera of Department of Health Bicol CHD. Palapakan po natin. Alam niyo po, si Doc Ernie po, si RD, ka-birthday ko po yan. We both share the same birthday, which is July 24. So parehas pa kami gwapo, tsaka matalino, tsaka maginoo. Ayan. Anyway, also here with us is Dr. Tess Belarma, the Acting Assistant Provincial Health Officer. Doc Tess, maraming salamat po for also representing our PHO men and women. Of course, napaka-importante po ng health dito sa ganitong klaseng convention po ba to or summit? It's actually an alliance, okay? Magkakaroon po dito ng pag-aalyansa. Ito yung mga iba't ibang grupo na may kinalaman po sa road safety. And also here with us is Senior Superintendent Alberto De Baguio, BFP Region 5. Palapakan po natin, sir. Thank you. My townmate, Police Lieutenant Colonel Dixon Berango, the Assistant Chief, Regional Operations Division. Lapakan po natin, Head. Thank you, sir. Mr. Wilfred Labrador, Head of Operations, Albay Emergency Management Services. Nandito po ba siya? Sa presidential table? Okay. Nandito rin po si Dr. Monray Isaiah C. Mancilia. Okay, sir. You are the head of the Non-Communicable Diseases Prevention and Control Cluster and Health Promotion and Communications Cluster. That's a mouthful. Okay, Doc Mancilia. Andito rin po si Dr. Rosa Maria B. Rempilio, LHSD Head. Palapakan po natin, Chief rather, of the DOH Bicol CHD. Thank you for your presence. Andito po ang aking panyera, si Attorney Miriam Royce Alzaga. Okay, the Provincial Director of One Rider Party List. Ayan. Si Rog po, si Attorney Rog, si Congressman po, kaibigan ko. Kindly extend my regards to him. He's doing a very good job in Congress. I have heard from a lot of congressmen, including my father, Congressman Lagman. Nag-aaral daw sa mga committee hearings. Andito rin po si Mr. Wawi Villanueva. Kaibigan ko to. Wawi, asan kayo? Steel Horses. Palapakan natin si Wawi. Okay, marami kang fans dito, Wawi. Andito rin po si Mr. Raymond Rufo, founder of United Cyclist Alliance of the Philippines. Ayan, Raymond, alam niyo po ba na when I was Vice Governor Raymond, can I see you? Can you please stand up to be acknowledged? Raymond, meron po tayong active transport ordinance which actually aims to make our cyclists feel protected in our roads. Kasi po, sa totoo lang, yung mga siklista po natin, they feel threatened. Dahil, of course, wala naman po silang kaha, yung kanilang mismong bike lang ginagamit nila. And within this administration, I assure you, Rufo, Mr. Raymond, I assure you that I will provide the proper funding for that ordinance to be effective. Importante po na finally magkaroon tayo ng mga dedicated bike lanes here in Albay. Maraming salamat po sa presensya mo, Raymond. Thank you. Andito rin po, sino pa po ba? I think I have mentioned everyone here on board sa ating presidential table. Bahala ka na, Christine, mag-apologize kung hindi mo na kompleto itong listahan mo. Okay. So, ladies and gentlemen, I will now read my speech. I hope you're inclined to still listen to me kasi po importante that the governor of this province is on board. Actually po, ang dami po natin mga events ngayon. I have this very important quarry issue being tackled right now as I speak sa Kapitolyo. So kindly excuse me after I deliver this important message because I need them to feel na talagang tayo po ay on board din sa mga quarry issues doon po sa Mulad, Bukad, Pequeño sa Ginubatan. So ladies and gentlemen, distinguished guests, good morning and a warm welcome to the Violence and Injury Prevention Alliance Regional Launch. Okay. I am honored to stand before you as the Provincial Governor representing our collective commitment to road safety and the well-being of our community. Today marks a significant milestone in our ongoing efforts to create safer roads and prevent violence and injuries in our region. The launch of this alliance brings together various stakeholders, organizations, and individuals who share a common vision, a vision of a community where every road user can travel without fear, a vision of a society where accidents are a thing of the past. Of course, accidents will always happen, but to minimize them will be a great leap, so to speak. Importante po na ma-minimize natin ang ating mga accidents. Road safety is not just an issue that affects us as individuals. It impacts the very fabric of our society. Each year, countless lives are lost. Families are shattered and dreams are destroyed due to preventable accidents. Pwede naman po talaga maiwasan kasi naman talagang may mga issues pa tayo on road safety. Education po, napaka-importante po rito. We cannot sit idly by and allow this to continue. We must take proactive measures to protect our citizens and ensure their safety on the roads. The Violence and Injury Prevention Alliance embodies our commitment to collaborative action, uniting government agencies, law enforcement, educational institutions, healthcare providers, civil society organizations, and concerned citizens. Together, we can make a profound difference in the lives of our people. Through this alliance, we aim to raise awareness, educate, and empower the community about road safety. We will work hand in hand to implement evidence-based strategies, enforce traffic regulations, importante po yun, sobra, and to enhance infrastructure. May mga roads po tayo na talaga naman kahit anong road safety measures in place, kung talagang baku-baku po yung mga daan at talagang delikado, wala rin po talaga tayong masyadong headway that can be expected. So kailangan po, dito sana si Engineer Baclao, malay natin mamaya, mapapunta po natin rito upang marinig niya po yung mga concerns ng ating mga stakeholders. I commend each and every one of you for joining this vital initiative. Your presence here today reflects your commitment to the well-being of our community. Your expertise, ideas, and dedication will shape the success of this alliance. Let us remember that road safety is not a solitary endeavor. Hindi po to kaya gawin ng grupo lang po ng One Rider Party List, ng ating Albay Provincial Police Office, ng ating EMS, ng ating PHO. Hindi po kaya. This should be a collaborative and concerted effort. So as we embark on this journey, let us keep in mind the lives that depend on us. the children who dream of a brighter future, the parents who anxiously wait for the safe return of their loved ones, and the countless individuals whose lives have been forever altered by road accidents. Let us honor their experiences by working tirelessly to prevent such tragedies from occurring again. Once again, I extend gratitude to each and every one of you for your presence and commitment to this cause. Together, let us forge a path towards a safer, more secure future for our community. Thank you very much, and Diyos babalos po sa inyong gabos. Oh, by the way, I think it's also very important when we talk about collaborative and concerted action, mabigyan din po natin ng daan na ma-acknowledge yung mga grupo po na pumunta rito. Andito po yung EARS Bicol, represented by, ito po silang Elite Aerox Riders Society, represented by Mr. LG Paklibar. Palapakan po natin, sir. Thank you so much. Andito rin po yung Full Spectrum Riders Association of the Philippines, headed by Mr. Galo Vergara. Tama po ba? O, dumating na po ang ating Provincial Director, Colonel Fernando Cunanan Jr. Palapakan po natin si PD. Thank you, PD, for being here. Alam niyo po, alam niyo si PD, from the moment I assumed the governorship, ang kanya talagang advocacy is road safety. Kaya po naman kung ikotabi ko mahiling sa mga dalan, especially along major thoroughfares ng mga TARPs, ito po ay isang ipag-edukar sa satuyang mga para-tricycle, sa mga of course, bisikleta, riders, na dapat po nandun sila sa right side ng road. And that should be second nature. Actually po, aminado ako, that in Albay, hindi ba yan second nature sa ating mga gumagamit po ng mga daan. Okay, sa Sorsogon po, kung makakompare ninyo, medyo mas malalim na ang kanilang consciousness na dapat po lagi nandun. So PD, we will continue on with that program. Kasi alam ko po, marami ang talagang benepisyo namang na pwedeng mangyari dyan kasi yung accidents will be lessened. Up to now, nagiging problema ko po yun going to the different parts of Albay PD. Meron pa rin po talaga maritigas sa ulo and siguro di na po masama na ako mismo ang sumisita sa kanila. O, sinasabi ko, baka naman pwede doon kayo sa right side, Manong. Diba, dumana ka mo, bawal ang bigigibunin do. Mabubugla ka na lang minsan pag blind curve and then nando na. Nasa harap po yung tricycle, so mahirap po yun. So, baka natin sa programa yan. Supportahan po natin yan. Andito rin po, of course, ang Kabalikat Civicom 40, represented by Mr. Efren Marcia. Asan po ba siya? Efren, andyan ka ba? Andyan ba si Efren? Looking for a friend? Okay. Anyway, andito rin po ang Albay Clasico, represented by Mr. Anthony Bertes. Andyan po ba si Mr. Anthony Bertes? Okay. Sige po. Of course, yung APO, na-mention po natin, yung PGA, yung PHO, yung PPOC, APSIMO, and of course, andito rin po ang ating private corporate sponsor, ang Motor Trade, represented by Miss Joy Gribialde. Palapakan po natin si Miss Joy Gribialde. Okay. So with that, ladies and gentlemen, we can now proceed with the program's direction towards the formal launch of this very important alliance. Sigirare po, Diyos babalos sa inyong gabos.
Ayun. Thank you very much, dear Governor. Despite of your schedule, talagang pinagbigyan mo po ang ating event for today. So, mga tuna, bago kita magpadagos, ayan. So, before we continue, for the information po ng lahat, ang tema po ng activity natin today is think before you walk, drive, ride sa Healthy Pilipinas. So, ladies and gentlemen, may acronym po yan, may meaning yan. So, mas mainam na malaman natin ano pa yung think, di ba? Sabi, ang T stands for tamang pagtawid. Yan. Ang question, tumatawid po ba tayo sa tamang tawiran? H, helmet wearing, seatbelt at iba pang mga protective gears.
Letter I, isipin at sundin ang traffic rules.
N stands for no to drink driving and substance abuse.
K, kaisa ang mga lider ng komunidad sa pagtataguyod ng ligtas na kalsada.
Ayan, so yun po ang meaning nun. So very fortunate tayo dahil sa message ni Gov, talagang kumbaga hindi ito isa lang na goal, kundi it's a collaborative effort by the local chief executives and other NGOs. Okay, moving forward, ladies and gentlemen, at this juncture, we would like to call up on stage our dear Regional Director of the Department of Health Bicol Center for Health and Development, no other than Dr. Ernie V. Vera.
Marainaldo po sa kabos. Good morning. Good morning. Yan. Dapat pag-araw ka ning tig-urulayan ta violence prevention, dapat perbi kitang aware. Good morning. Okay. Okay. Mabalas po sa inyo kabos. So before po I proceed po with my tataramon, gusto ko lang pong umaon at bigyan ng importansya po yung mga sumusunod na tao rin. Niya po sa tubo niya po si Attorney Miriam Roy Salsaga she is the Provincial Director for Buwan Rider. Good morning, ma'am. Niya po si Superintendent Alberto Di Baguio, BFP Region 5. Good morning po. Mr. Wawi Villanueva, Bicol Steel Horses. Ano yun po siya? We have Police Community Precinct Commander Brian Palan, PNP PRO 5. Raymond Rufo, founder of United Cyclist Alliance with the Philippines. Good morning po. Of course, ang satuya pong governor, si Greg Salagaman po, nainod na po siya, may nakabo po siya. And we have Regional Director Francisco Ranches of LTO 5. Good morning. Of course, Dr. Tess Bilarma, Acting Assistant Provincial Health Officer. We have also Police Colonel Fernando Cunanan Jr., Albay Police Provincial Office Provincial Director. Good morning po, sir. We have Board Member Victor Siga, Chairperson on Health and Social Services. Wilfredo Labador, Head of Operations sa Albay EMS. Ano yun po siya? EMS po ini, importante po ni. And of course, we have our very own Dr. Rosa Maria Rimpilio from the LSS, the Chief from the DOH Regional Office 5. We have Dr. Monray Mansilla, in charge of the Violence Prevention Program from DOH Bicol, and Sir Samuel Banico. And of course, Dr. Claveron. Ini po ang team kan sa muyang VIPP Bicol CHD. Isang malusog na araw po sa mga local government units, national government agencies, non-government agencies, hospitals, media partners, at sa mga cyclers. Welcome po sa regional launching ng Violence and Injury Prevention Alliance na may temang Think Before You Walk, Drive, Ride sa Healthy Filipinas. Ayon sa World Health Organization, ang mga injuries o pinsala, violence-related o hindi sinasadya, ay nagdudulot ng 4.4 million pagkamatay sa buong mundo kada taon. Base sa datos, mga edad 5 to 29 gulang ang madalas na biktima nito. 3 mula sa 5 sanhi ng kamatayan ay injury-related. At isa na rito ang road traffic injuries na paksa ng ating regional launch ngayong araw. Ang kaharasan at pinsala ay mapanganib sa pambansang ekonomiya, kawalan ng produktibidad at pagpapatupad ng batas. Kaya naman, ang National Policy on Violence and Injury Prevention ay nabuo upang magtatag ng isang pambansang pulisiya at strategic framework para sa injury prevention activities ng Department of Health, ibang ahensya ng gobyerno, LGUs, non-government organizations, mga komunidad at individual. Ang Violence and Injury Prevention Program ng DOH ay alinsunod sa National Policy on Violence and Injury Prevention. Sa loob ng programang ito, ang DOH Bicol CHD ay patuloy na magbibigay ng technical assistance, monitoring at advocacy campaigns para sa pag-iwas sa pinsala at karahasan, lalo na sa mga road traffic injuries. Dahil dito, ang DOH Bicol CHD ay patuloy na pinapalakas ang VIPP sa pamamagitan ng pagsasagawa ng mga aktibidad, lalo na sa road safety. Isa dito ang Road Safety Champs Contest na layuning magbigay halimbawa ng ligtas na pagbibisikleta at malusog na pamumuhay. Kasama na rin dito ang Juana Be Wise, isang health promotion playbook na nagbibigay impormasyon sa mga magulang at tagapag-alaga na isabuhay ang positibo at malaya sa karahasan ng mga parenting practices. Hinihikayat ng DOH Bicol CHD ang mga LGUs at iba pang stakeholders na tiyakin ang pagpapatupad ng mga evidence-based policies, standard at guidelines sa kanilang mga constituents. Ang health promotion developing capacity, injury surveillance system, networking, resource mobilization monitoring, and evaluation ay mahalagang plano ng aksyon sa pagpapalawig ng VIPP. Sa pagkamit ng universal healthcare, ang pagtiyak ng makatarungan na health financing package, research development at service delivery ay anyo ng pangunahing pag-iwas at pag-alaga sa mga napinsalang tao, lalo na sa mga nagbibisikleta. Hinihikayat ng DOH Bicol CHD ang publiko na isabuhay ang healthy behavior of doing no harm and putting safety first. Pinaalahanan din ng publiko na sundin ang mga hakbang sa kaligtasan sa kalsada at responsable pagmamaneho at pagbibisikleta upang maiwasan ang mga pinsala at karahasan sa kalsada. Diyos maray na hala po sa Induga Boss. Thank you very much po.
Okay. Thank you, Dr. Ernie Rivera, for that very inspiring message. Last year, the Violence and Injury Prevention Program and Health Promotion Unit of the DOH Bicol Center for Health Development and the Violence and Injury Prevention Program Coordinator of the Albay Provincial Office conducted a learning visit in Region 6. The DOH Western Visayas Center for Health Development was the pilot implementer of the Violence and Injury Prevention Program in the Philippines. Representative from the Bicol region gained knowledge on how to ensure the effective and efficient implementation of programs that are geared towards injury and violence prevention. We, as a member of the Violence and Injury Prevention Alliance, it is also our duty to be informed on how to ensure that our fellow Bicolanos are safe for injuries and violence. So, let us listen and be inspired by the local Health Support Division Head, Dr. May Ann S. Santa Lucia. So, we will be having a video presentation of Dr. Santa Lucia.
Good day, everyone. So greetings from Region 6, the Department of Health, Center for Health Development, Western Visayas. And I would like to greet all the participants in this activity of Bicol Region, and most especially Director Ernie Vera and Dr. Rose Rampilio. I will be your facilitator in this session. I'm Dr. Mayan Suliva, Santa Lucia, Division Chief of the Local Health Support Division of DOH Western Visayas. For my order of presentation, we're going to discuss the following: Administrative Order of the 2014-0002, which is the revised national policy on violence and injury prevention. I'm going to have some slides on road safety adapted from the Johns Hopkins Global Road Safety Leadership Course. We're going to discuss a post-crash response, which is Pillar 5 of the road safety pillar and is lodged within the health sector. And another administrative order of 2014-0007, which is the national policy on the establishment of the pre-hospital emergency medical services. And lastly, the best practices of Region 6, which we're going to share to you. So many months back, a Bicol team went to Region 6 for some sort of lakbay aral, and they were able to learn many good practices of Region 6. So for the first topic, which is AO of 2014-0002, which is the revised national policy on violence and injury prevention. The rationale of this is, let's go back to history. You could see that the data dates back to 2009 and 2011. So the first global study on premature deaths in 2009, that is the WHO report, revealed that several conditions like road crashes, we have suicide and violence are the main causes of death worldwide for people aged 10 to 24 years. And in 2011, injuries were reported to be responsible for 9% of all deaths, with road traffic injuries claiming nearly 3,500 lives each day. So that makes it as the 10th leading cause, part of the 10 leading causes of mortality globally. So in response to this, the World Health Organization called upon member states to develop measures to prevent road traffic injuries and violence. And WHO recommended that such policies, we have the strategies, the plans of action, must be concrete and contain objectives, priorities, timetables, and mechanisms for evaluation. So in the Western Pacific, the WHO called its member states. So we would like to take firmer action and reduce the region's more than 600 suicides. Could you imagine 600 suicides per day? And during the 5th milestone in a global campaign for violence prevention in South Africa, the Violence Prevention Alliance developed this plan of action geared towards increasing the priority of evidence-informed violence prevention, and that's also building the foundations for violence prevention and implementing violence prevention strategies. So the UN General Assembly adopted the resolution proclaiming 2011 and 2020 to be the decade of action for road safety. So that brings us to how everything started for the Violence and Injury Prevention Program. And the Global Burden of Disease, Injuries, and Risk Factor study conducted in 2010 showed that interpersonal violence, the road traffic crashes, drowning, and suicide ranked 6th, 11th, 17th, and 27th, respectively, as the leading causes of premature deaths in the country. So we have this ONACE, which is an online system. It is called the Online National Electronic Injury Surveillance System, and there is a fact sheet for ONACE, which is being released every quarter. It revealed that transport or vehicular crash was the leading cause of unintentional injuries and interpersonal violence, which would come in the form of assault, contact with sharp objects, and even gunshot as the leading cause of intentional injuries. So with this increasing mortality, morbidity, and disability due to violence and injury, there really is a need to complement and enhance the existing policy on violence and injury prevention in order to rise to the challenge of addressing this rapidly growing public health. So I'd like to very briefly state some policies, declaration of policies for this. So we have the 1987 Philippine Constitution, Article 2 of Section 15, which states that the right of the people to health protection and promotion, and Article 13, Section 11, stating the availability to the people of all the essential goods, the health and social services at affordable cost. So we also have the Aquino Health Agenda through AO number of 2010-0036, Section 7 of EO 43, Series 2011. We have the so-called KP, or the Kalusugan Pangkalahatan, which aims to achieve the UHC, or the Universal Healthcare. I know that most of you have heard about the Universal Healthcare. So it's also establishing a culture of safety, which must be an essence of the VIP program. We also need to have an integrated, comprehensive, sustainable, multi-sectoral approach to prevent violence and injuries. And this must be in close collaboration with multi-sectoral stakeholders. That is why the essence of the VIPA, which you are supposed to form, the Violence and Injury Prevention Alliance, must be multi-sectoral in nature, involving not only the health agencies, but the non-health agencies as well. We also have highly effective and sustainable strategies, which must be developed so that changes would lead to significant reduction in mortality, morbidity, and disability. And establishing an EMS, this is another administrative order, the Pre-Hospital Emergency Medical Services, which will be explained in future slides. So we have the following objectives for the Violence and Injury Prevention Program. On a general scale, it is to reduce mortality, morbidity, and disability, and specifically to promote a culture of safety, to enhance the capacity of the regional office, strengthening its collaboration with other agencies, and developing and implementing evidence-based policies, standards, and guidelines, and ensuring a reliable, timely, and complete data and researches related to VIP. So the scope of this AO, so it covers all units and instrumentalities, including attached agencies of the Department of Health, and it applies to other government agencies, LGUs, we have the academe, civil society organizations, and many others. So the DOH is the focal agency with respect to VIP, and as such, it must design, coordinate, and integrate plans, projects, and activities. So we have this revised national policy, and 7 years back before this, we have the original policy on violence and injury prevention. So the following are the VIPP sub-programs. I choose to be with the non-communicable disease cluster, the regional as well as the central office. But lately, that was a year ago, it was transferred to the Health Promotion Unit and the Health Promotion Bureau at the central office. So out of the 10 sub-programs, we have some which were transferred to other programs. So these are the 10 sub-programs. The first is road traffic injuries. So we have every November, we celebrate the World Day of Remembrance for those who have been killed in road crash. And May is the month for road safety. The second sub-program is burns and firework-related injuries. That's Tewas Paputok of the firework-related injury prevention of the DOH. These two, road safety and FWRI, are still under the violence and injury prevention program, as well as drowning, which is a silent killer among children. The third sub-program is still under VIPP, as well as falls. For the sports and recreational injuries, it was transferred to the environmental and occupational health, and animal bites was transferred to the infectious disease unit under the Rabies Prevention and Control Program. So we have suicide that's being celebrated every September as World Suicide Prevention Day. It was transferred to the Mental Health Program, as well as the interpersonal violence related is under the Health Promotion Bureau. That's priority area number 6. We also have occupational and work-related injuries. That's under the EOH, under the infectious as well as the poisoning and drug toxicity. So these are 10 VIPP sub-programs. Remaining are 5, and the top 3, which are of importance, are road traffic injury prevention. We have the drowning as well as the fireworks-related injuries. So the next subtopic is road safety. This is an adaptation of the Johns Hopkins Global Road Safety Leadership Course, wherein I was privileged to attend in 2017 in Baltimore, Maryland, USA. So this is under the Johns Hopkins Bloomberg School of Public Health. So I would like to acknowledge that this is the source of some of the slides in this presentation. So for road safety, I know that you have many guests, facilitators, speakers on road safety. I saw the program that you have the LTO, the LTFRB, the DPWA. So health, you might be wondering why the DOH is with road safety. So the 5th pillar, post-crash response, is lodged under the health sector. So other pillars are the following. So we have pillar 1, which is road safety management, is in charge of the multi-sectoral partnership among concerned agencies. So this is led by the Department of Transportation. We don't have the DOT at the regional level. That is why the Department of Health, VIPP, took the initiative of convening the multi-sectoral agencies. So just like what you're doing there in Bicol region, you are right now actually convening the different agencies for road safety. So at the regional level, we have the LTO and the LTFRB doing the tasks of the DOT. So for the second pillar, which is safe roads and mobility, we have the DPWH as the lead agency. And for safe vehicles, we have, as I said, LTO and LTFRB. For safe road users, this is lodged upon the shoulders of the local government units. They must be responsible for keeping their constituents safe from road traffic deaths. And the last pillar, which is post-crash response, is for the health sector. So I have some slides here later on post-crash response. So as per statistics, more than 1.3 million people are killed in road crashes worldwide every year. We don't anymore call them road accidents, because when we say accident, nobody is responsible. So the terminology that we use is road crash. So one child is killed in road crashes every 3 minutes in the world. Could you imagine? It's not every day, but every 3 minutes. And the total worldwide death toll of the tsunami, if you remember, in Aceh, Indonesia, that was in 2004, which involved several Asian countries, the death toll was 230,000. So if you multiply this by 5, the annual worldwide death toll of road crash is 1.2 million. That is why we call road crashes as the modern day tsunami. Road traffic injuries are the leading cause of death among young people that age 15 to 29. And 91% of the world's fatalities on the roads occur in low-income, middle-income countries like the Philippines. So half of those dying on the world's roads are vulnerable road users. Even if we have cars, we have vehicles, all of us are pedestrians. And we also have the cyclists and the motorcyclists as the vulnerable groups for road crashes. Only 28 countries, that represents 416 million people, and that's only 7% of the world's population, have adequate laws that address all the 5 risk factors. So what are these laws? So we have speeding, we have laws on drunk driving, helmet use, seat belt use, as well as child restraints, which was approved just a few years back. What is important is the implementation of these laws. So let me inform you, or let me give you some slides on the Hayden Matrix, which is a conceptual model for the systematic exploration of countermeasures. So this provides an integrated approach to injury control. And this matrix includes three events. We have the pre-crash or the pre-event, the crash event, and the post-event or the post-crash phases. And we also have several factors like the human factor, the vector, the agent, or the vehicle, as well as environmental factors. So these are the three major highway traffic components. We have the human factor, the person, the vehicle, the vector, and the environment. So in the Hayden matrix, it says that for the human factor, we could say that crashes, be it pre-crash, post-crash, or during the crash, is dependent in one way or another upon the person, because that person may be on alcohol use, or that person may be speeding, or that person does not wear protective gear. So human factor is part of the Hayden matrix. We also have the second factor is for vehicles. So does your vehicle have the brakes and the well-functioning lights? And in terms of environment, is there adequate street lighting? Are the roads concrete, paved roads, or are there road barriers which could cause your crash? So this is another slide showing the time frame, the phases. So in the pre-crash, intervention can prevent the following. So it could prevent the death, the injury, as well as preventing property damage. In the post-crash phase, it could also prevent, but only in terms of deaths and injuries. And for the post-crash, intervention can reduce. So it cannot prevent, but it could reduce the chances of death and injury. So another slide on the Hayden matrix. So this is just a sample slide showing the interplay between the three factors, the human, the host or the person, the vector, the vehicle, and the environmental factors could either be physical or socioeconomic, interplaying with the three phases, the pre-crash, the crash, as well as the post-crash. So let's go to the human factor. So in terms of post-crash, it could be avoided if the person did not have any intake of alcohol before driving. For the crash, that person must use the seat belts, and post-crash, it could have prevented disabilities. For the vector, for the vehicle, we have visibility measures before the crash, the use, the functioning of the airbags during the crash, and the availability of first aid post-crash. So there are also issues about how timely first aid or our EMS providers would come on scene. So in terms of the physical environment, so we consider pre-crash the street lights, and for the crash event, we also consider if the roads are clear, if they are visible, and for post-crash, the response of. So in terms of the socioeconomic, we have social norms. So we have the drinking, which is a vice and which is a top killer, top cause of these road traffic crashes. We also have the seatbelt laws, how people are knowledgeable, but sometimes behavior is also very important, because no matter how much knowledge you have about the seatbelt law, if you refuse to obey that law, you have an attitude problem, there are behavioral problems, then it's to no avail. And we also have the availability of your EMS. The next subsection is post-crash. This is the EMS, the emergency care system. So again, I would like to reiterate that 1.3 deaths from road crashes occur globally, and injury is one of the leading causes of mortality and morbidity worldwide. And every year we have 5.8 million people die because of injuries, and more than 90% of deaths occur in low and middle income countries. So we also have an overwhelming proportion of these deaths occurring before the patient ever reaches the hospital. So it's very important that emergency care system, including the pre-hospital care, is very important and can save lives and can reduce this global burden significantly. So in this slide, it shows emergency care for injury is at the core of the post-crash response. So we have effective care of the injured, which requires a series of time-sensitive actions. So that begins with the activation of your emergency care system and the continuum of care. So continuing with care at the scene, during the transport, as well as the facility-based emergency care. So the WHO Emergency Care System Framework, this describes the essential functions of an emergency care system. So this is just on the slide. What you see on the slide is a visual summary which illustrates the essential functions of a responsive emergency care system. And the key human resources, so we have the equipment, the information, technologies related to execute them. So care at the scene, studies indicate that the proportion of patients who die before reaching hospital in low and middle income countries is at least twice of that compared to that in high income countries. So this suggests that the strengthening of your pre-hospital EMS could have an enormous global impact. So we have optimal pre-hospital care being provided by a responsive system, and this could rapidly dispatch the equipped ambulance units, and that must match with the trained providers as well as extrication services when needed. But where this is not available, so there are many ways to improve basic care at the scene of a crash. So this picture shows targeted at the community members, the emergency first aid responders training. So since this is an international course for the JSL in Baltimore, so we have examples here in foreign countries. So the transfer of the injured either from the scene of an injury to a facility or between facilities has two distinct components. So what are these? So we have the transport and care during transport. So we need well-equipped ambulance with trained staff. That's ideal because they best allow the delivery of uninterrupted life-saving before reaching the hospital. So there's a review which says that we have a recent review identifying 8 studies on the impact of pre-hospital care from 6 low and 6 middle-income countries, and combining the combined analysis suggests that if you implement this pre-hospital care, it could reduce the risk of death in injured patients by 25%. And ensuring that an injured person is taken as soon as possible to a hospital, that hospital must have the right equipment and personnel to provide the needed care. These things are very crucial. So a system of center designation can set the standards for injury care and designate certain hospitals as trauma centers. So we have even the short delays. These are critical to intervention. It could mean loss of lives. So lastly, on the part of rehabilitation and reintegration, we know that long after the crash, the survivors and their families can suffer persistent physical as well as psychological conditions. When not appropriately treated, they would restrict the ability to function normally in work and personal lives. So we need to adjust to long-term physical impairment and associated disability or disfigurement. This can put individuals at risk of developing psychological disability. So rehabilitation can help to alleviate suffering, to prevent the risk of harm, as well as optimize functioning. So psychological support is very important because a large portion of our crash survivors experience post-traumatic stress disorder. We have major depressive disorders as well as anxiety disorders. It's very important that mental health support is given to these victims, to these patients, because they can mitigate many of these conditions. So I would like just very quickly to show in pictures the best practices of Western Visayas not only on road safety, but on suicide prevention, as well as on drowning prevention. So just very quickly, I'm gonna breeze through the slides and pictures, mixed with the Administrative Order of 2014-007, which is the National Policy on the Establishment of Pre-Hospital EMS. So this has 4 components. The first component is dispatch, so you also need to institutionalize this. After institutionalizing your VIPP there in Bicol, you need to go to this administrative order because pre-hospital emergency medical services is very important. Can actually reduce mortality, morbidity, as well as disability. So the first core component is emergency dispatch. This involves immediate identification. You need to prioritize emergency situations, so you dispatch the most available resources. And this encompasses all aspects of communication. So we were able to conduct a big T.H.I.N.K simulation exercise. That's the overshooting of the runway of an airplane in our international airport. So this shows the first phase, the impact. So that's the entry of the crash fire and rescue of the Kaakibat. We also have multi-sectoral involvement. So we have the Coast Guard providing their K9, as well as the extrication process being done by our DRRM officers, trained personnel. So we have the collection area before the advanced medical post where we position our victims so as to decongest the advanced medical post. The second of the core component of EMS, pre-hospital EMS, is the emergency response in care, which involves arrival of resources at the scene and the timely initiation of interventions. So in the picture, we have our advanced medical post set up by Red Cross in a matter of just 5 to 7 minutes. The third component is emergency transport. Do not ever transport patients who are unstable. So this is transporting them to the most appropriate facility. And in the transport phase or during transport, you need to provide continuous care, continuous monitoring of the conditions of the patients, because the yellow tag patients could become critical during the transport phase. So these are pictures of our transport to the different hospitals. These are hospitals which are 45 minutes, some 10 minutes, 15 minutes away from the impact site in the Iloilo International Airport in municipality of Cabanatuan. So we also had a showcase of the TOG-6, the Tactical Operations Groups, the Philippine Air Force, which was able to deploy 2 choppers. And these patients were brought to sports complex. They were picked up by the chopper, which had medical personnel, and they were able to provide medical air evacuation and brought the patient from the chopper down the ground at the complex to the nearest hospital, which is Iloilo Mission Hospital. So we have the casualties. Despite the pouring of the rain, horrendous rain, the 5 dead victims really played their part well. They didn't stop. They were really our actors. So these were our casualties, and they were transported through the vehicle of the PNP. So we don't transport dead patients in the ambulance. In the last phase, which are inter-facility referral and transport, so we transport the patient with medical escorts, if necessary, from one facility to another hospital, depending on the choice of the folks, if they transfer the patient from level 1 for stabilization to a level 2 or level 3 hospital. So we're able to transport our Cymex players to Iloilo Doctors Hospital, which is a private hospital, and some of the onlookers really thought that it was a real scenario, but we're able to get the consent of the medical director. So we brought the patient to the emergency room and eventually to the operating room. So this is the role of the regional office of the DOH to provide technical assistance to the LGU and oversee institutionalization of your EMS. Again, another big drill happened after a year. This is the road safety drill. So the scenario, that's multiple, from road traffic injury, there's a road crash, then there was an explosion between many vehicles. We conducted this in Negros Occidental, and this is another one of our epic drills. And after the explosion, a fire ensued, and we were able to to display our capabilities on chemical, biological, radiological, nuclear explosives because Amity Public Safety is trained on sea burn response. So these are the pictures and of the drill in Negros Occidental. So the Violence and Injury Prevention Alliance is a multi-sectoral thing which was launched in 2014. We were the first region to institutionalize the VIPA, or the Violence and Injury Prevention Alliance. So this actually happened on my 50th birthday last May 2014. So the VIPA was born when it was my 50th birthday. So another picture is on the strategic planning we planned, and part of this planning is the T.H.I.N.K, which was the T.H.I.N.K which occurred in 2014. So after the organizational meeting, we have a grand launching, not only of the BIPP, but the ENCD prevention of blindness as well. So we started small, and we ended up having a big alliance with more than 200 participants quarterly for 5 consecutive years before the pandemic. So after the regional launching, we had a series of launching in the 6 provinces of the region. So this was in Capiz, Aklan, Bago City, Antique, Guimaras. Bago City is a city, but it locally funded the launching of VIPP. So we also have the launching with international guests. We have Mr. Jonathan Pashmore from WHO gracing the event together with the Patron of Negros. So the alliance, these are the members of our alliance, all the health offices. So every quarter we invite all PHOs, CHOs, MHOs, and the DRMOs from the provincial down to the municipal level. And we also have other agencies. After the pandemic, we enhanced the attendance. We had more and more regional agencies attending our VIPA. And actually this coming May and November, as well as in July, we're going to have big VIPA activities, and we'd like to invite again the Bicol team to witness this. So these are the objectives of our alliance. Supposedly they're only tasks for advocacy, but later on the scope was widened, so they are involved in advocacy, in enhancing preventive strategies, providing TA. Some of them serve as resource speakers because we actually have a core of trainers which were discovered not only from BIP but during our HEMS, Health Emergency Management Staff Days. So we have the 5 Ps. When I presented this in Africa, in Canada for the first time, I employed the 5 Ps, category or strategies, which are the following: policy and protocol formulation. So we had the policy adopted on drowning prevention. We were able to make a prototype ordinance on drowning prevention, now being cascaded in the different provinces. We also have developed a protocol on EMS in 2019. So these are the pictures. And the T.H.I.N.K, I already showed this in previous slides. So this is a picture of the HAZMAT, the hazardous materials response for the sea burn in the T.H.I.N.K in Negros Occidental. So during the pandemic, we also had this last year, industrial explosion T.I.N.K. President Rojas is the first to have it during the pandemic in province of Capiz. So it was a sugarcane industry wherein there was an explosion, and we were able to portray the different phases of EMS. So our road safety ordinance is being supported by the Public Safety Transportation Management Office of Iloilo City. In the picture, the heads. So we also have, this is a picture of our protocol. And in terms of partnership, as I have said, we have quarterly alliance meeting with different teams. First quarter is drowning, because that time we have not yet declared the World Drowning Prevention Day that is to be in July, so it was only last year. So every quarter we have different themes. Like for the first quarter, we have a drowning prevention theme. Second quarter, road safety. Third quarter, it's mental health and suicide prevention. And last quarter is injury prevention, that's Iwas Paputok, and dovetailed with the World Day of Remembrance. So we were the first region to conduct a very big regional rescue Olympics attended by 470 participants. So there were 3 categories: the water search and rescue. We had Bicol extrication, and we have firefighting. So there were several agencies which joined the competition and were able to give cash prizes and plaques. So we relived the VIPA last year. That's in 2021. We started small with 50. We cannot gather 200, but this year we'll start again reviving the VIPA. What I mean in reviving is reviving the quantity. That's would be more than 250 participants, just like before the pandemic. But immediately when we first started, we just had the regional agencies. This picture showing only 50 participants last year. This year, starting this year and the future years, we will resume with the big VIPA thing. So in terms of promotion, we have the following. We have school forum, 500 students times 3 schools for 5 consecutive years. So we also have mental health advocacy, collaboration. This is the Drowning Prevention Summit. In schools, we teach them how to use the life vest. So the Coast Guard demonstrate this while I lecture on 3 topics: road safety, suicide, and drowning. So these are pictures, more pictures of the annual forum. We also have Road Safety Summit attended. Actually, the first, the workshop, enhancement workshop for the Road Safety Plan, PRSAP, was conducted in the Visayas, and that's in Region 6. So we have several signages, 5 feet tall, along SM City going to the airport of different design specs. We have a local version of the Baltimore training, the Global Road Safety Leadership course. So we named it Basic Road Safety Management course. You could invite us and we could conduct the course there. So we had multi-sectoral participants. And I was with the local instructors aside from my classmates in Baltimore. So this is our former regional director supporting the road safety. And these are pictures of us being interviewed by media when we installed the different road signages. So we have more than 12 prototype designs on road safety as well as on drowning prevention. So this is a picture of the students during the poster making contest for suicide prevention, drowning prevention, and road safety. And this was featured in Canada during the World Conference for Drowning Prevention. So I'd like to give due acknowledgement to your Regional Director, Dr. Ernie Vera, for choosing me to attend the World Conference in Malaysia in 2015. So that started everything. I was a participant, and after 2 years, they invited us to submit an abstract. So the abstract passed the screening, so we were able to present our best practices in Canada and in South Africa. So this is a picture of our car stickers. We used to have car stickers. So the road signage installation, slow down along SMCT. These are more pictures. And second batch of installation. So we had 2 batches. So turnover ceremony, SMCT Iloilo, slow down in schools. You could see the student, this is also 5 feet tall. These are on 2 sides. Back to back, we had more than 100 participants. And you could see in the picture the students carrying the signages, bringing it to their school. So this is the PNP singing the road safety song, Aksidente sa Daan. So these are the pictures of our recipients, the students, the principals for the road safety. So these signages are reflectorized, GI sheets, and they have a lifespan of more than 3 years. So these are more pictures of the children carrying the signages. So the different schools, recipients of our signages are UP, we have Hibawan, we have both private and public schools. So Oton, Arevalo Elementary Schools, we have Molo District, National High School, Rizal Elementary School. So we also have Colegio de las Ciudades de Jesus. This is an exclusive girls' school, private school. And we also gave to Colegio del Sagrado, Corazon de Jesus, another private school, San Andoni Memorial Elementary School. We have Haro 2, Haro 1, and Assumption Iloilo were able to give signages. So pictures of our school forum and our media advocacy and our posters. Not only on road safety, but on drowning prevention. So we have TV advertisements, radio advertisements, and TV advertisements. The first World Drowning Prevention Day was last year, 2022. We launched this in Robinson's Iloilo with more than 100 participants. And it was not only an advocacy event, but we were able to showcase the different logistics that we have. It was a DOH Health Festival. This is my brainchild, so I gathered all the different programs. We showcased the logistics, we gave logistics to the people in the mall, as well as we provided services, the Philippine risk assessment. We also had mental health services and family planning services, nutrition, dental health services. Together with, we dovetailed this during the launching of the Health Festival and the World Drowning Day. Prevention, we had the Coast Guard displaying their big rubber boat. So we are also a recipient of the World Health Organization project. So the first phase is the formulation of the action plan and comm strategy on drowning prevention. And we also are done with the second phase, and we'll be entering the third phase. So more on the best practices, we have a module on VIPP who would also invite us to teach the course. So we have conducted these 3 batches during the pandemic, and I have a pool of facilitators with me conducting this. We share this, we by invitation from Northern Mindanao, from ARRMN. And in terms of people, we have trainings, capability building. For the Johns Hopkins course, we have conducted 3 batches before the pandemic. So we also have emergency vehicle operations course with technical assistance from Philippine Red Cross. We engage with PUV operators. We also have standard first aid for traffic enforcers. So actually, Bicol Group has this PowerPoint, and they could replicate our activities. So we also provided TA during the APEC and Asian Summit, as well as in ARMM and Region 12 in SOC Sargent, as well as in the different provinces, like the road crash, CIMEX, in different municipalities and provinces. We have the drowning prevention launching. So we also have TWG meetings, program implementation review, and we also have other activities, like we have international linkages. So as I have said, the attendance to the Johns Hopkins course. So we visited Virginia, wherein there's a big area there for all the vehicles. They crash them and test which of the vehicle is the best. So they declared the car of the year. So we visited Bloomberg Philanthropies in New York City. And this is a picture of our graduation. So there were 7 participants from the Philippines. So for Canada, I attended the milestones meeting for violence and injury in Ottawa. So this is in Malaysia, where Dr. Vera, our RD, asked me to participate in. So this was in Penang, Malaysia. And after 2 years, I was able to present, not just as participant, but as presenter of our best practices on drowning, entitled Unleashing the Power of Cooperation, Coordination, Commitment, Collaboration, and Camaraderie Among VIPA Agencies. So this is a picture of the presentation. So after, again, another 2 years, I got to present in Africa, and this is the title of my presentation. So this is a picture in South Africa, and in Australia, in Sydney, Region 6 was able to present 2 presentations, one which is virtual presentation on road safety, and the other one is face-to-face on drowning prevention. And again, this was in Adelaide, Australia. So there's another organization wherein we submitted our abstract And it also passed as poster presentation, and we're going to present this in Perth, West Australia, this coming November. So the title, so I would like to say that in VIPA, in the Violence and Injury Prevention Alliance, we have the power because we are united, we have camaraderie, we have the coordination, we have the collaboration, the communication, coordination, and cooperation. So when we meet together, we are known by different names and different agencies, but when we come together, we don't call ourselves the DOH, the Bureau of Fire, or the BNP, but we call ourselves the VIPA, or the Violence and Injury Prevention Alliance. So thank you so much, RD Vera and Dr. Rose, for inviting me and giving me a chance to present on road safety and VIPP in general, as well as to share the best practices of Region 6 in terms of injury prevention. Thank you so much, and I hope to be there in the next batch of your activity. Thank you, and good day, everyone.
There you have it, ladies and gentlemen, the presentation of our Dr. Mary Ann Santa Lucia from Regional DOH Region 6. So, hello!
Buhay pa ba?
Hi!
Buhay pa?
O, sabi ni RD, dapat tayo alert lagi.
Yes.
Bawal yung tutulog-tulog tayo, lalo na kung nagdadrive tayo ng ating mga sasakyan. Tama ba? Yes.
So may mga natutunan po kayo, di ba? So let me give you a brief experience with the DOH Western Visayas 6. Yes, I was one of those who visited their place for learning visit. So si Dr. Santa Lucia, very special po talaga siya. So magaling po talaga siya. Siya po yung nag-mentor sa amin kung paano po namin sisimulan yung activity niya to, and we did the planning. So this activity would not be possible kung wala po yung guidance niya sa amin. And sad to say, hindi po siya nakarating because of the bad weather condition today.
Before we go further, we would like to acknowledge Dr. Rosa Maria Rempilio. Doktora, good morning. Ayan, so challenging ito sa part natin. Kaya ba natin? Kaya ba natin? Yan, dapat that's the spirit. Kumbaga, kanina tinitingnan ko ni Hazel yung mga datas, then yung mga best practices nila. Sabi mo nga kanina na ginagawa na natin dito, kaya lang medyo may kulang pa. Yung synchronize, yung isa talaga yung galaw natin para somehow talagang ma-promote natin, ma-advocate natin yung mas mababang cases ng mga violence and injuries, especially sa mga road vehicles.
Okay.
Yeah.
So since nandito naman po tayo, so if ever mag-ask kami ng support from all of you, maipapromise po ba natin na you will give all your support para po ma-reach natin po yung mga goals natin, especially for this program. Susuportahan po ba nyo kami? Yes or no? Yes.
Okay.
So ayan ha.
Kasi may commitment wall tayo mamaya, magsisignify tayo doon. So, at this juncture, ladies and gentlemen, to give us another intermission number, let's welcome Fire Lane Band of the Bureau of Fire Protection, Regional Office 5.
Alright? Check. Sound. Ayan, good morning po ulit sa ating lahat. Once again, kami po ang Fire Lane Band. So, ito pong kantang tutugtugin namin ngayon is an original composition po ng aming grupo. So, makaka-relate po siya sa event ngayon kasi this is entitled Ligtas na Pilipinas. And of course, ang message po ng song namin is ang safety ng everyone is nagsisimula sa bawat isa. Ngayon po, sana po magustuhan po ninyo yung song namin ngayon.
Again, thank you so much, the Fireland Bureau of Fire Protection Band. Palakpakan natin mga kaibigan. Ayan. So, moving forward, ladies and gentlemen, to give us the road safety programs of the Land Transportation Office, Regional Office 5, may we call on Mr. Chris Gerald A. Martinez, Assistant Chief of LTO Ligao. Ayan. Palakpakan natin si Sir. Ayan.
Thank you, sir. Good morning po. Magandang umaga sa lahat. And masyado atang formal to. Labas ako ng konti dito. Okay lang po? Okay. So, in behalf of our Regional Director Francisco Ranches Jr., I would like to present to you yung aming pong mga activities na ginagawa and then programs ng LTO, specifically focused po sa road safety. Sir, okay. Napindot na ata nila. So this was supposed to be inverted. Yan. No, and I intentionally did it. Actually, nakuha ko yung idea. Kasi gusto ko sa simula pa lang nung konti, nung maiksing presentation namin, makuha ko yung attention ninyo. Bakit po? For the past few years, lumalaki, tumataas, based on statistics po, no? Tumataas yung cases natin ng mga road crashes and accidents. Mas marami yung nagiging victims. No? Mas marami nasasaktan yung pamilyang nawawalan ng mahal sa buhay. No? And simply because itong issue ng road safety, hindi natin binibigyan ng atensyon. So I would like to begin this sharing, kukunin ko yung attention ninyo, kaya binaliktad ko po yan. Please, sir. Itama na natin. No? Ngayon at nakikinig na sila sa akin, itama na po natin. Okay. Violence and injury prevention. Now, let me continue by sharing with you kung paano po nag-fit sa road safety campaign yung mandates ng LTO. No, yung mandato namin. So basically, please, next. Ito po yung ginagawa ng LTO. We issue driver's license dun sa mga qualified drivers. And on the national level, nag-evolve na po ngayon yung pag-i-issue ng driver's license. Mas mahal, no, yun yung nakikita ng iba, na mas mahal na sir, mas mahirap. But for the purpose of road safety, yung mga issues po natin, in-implement po itong policy na kailangan yung student driver dumaan ng 15 hours theoretical driving course. That is mandatory. Kahit saan po sa buong Pilipinas, required na po yung theoretical driving course. And before kayo ma-issuean ng driver's license, non-professional, kailangan mag-undergo kayo ng practical driving course. So meron na tayong 2 kurso na nilagay. No? Just to make sure na yung ating mga drivers po, hindi yan lalabas sa kalsada dahil lang marunong yan mag-drive. Lalabas yan, magdadrive yan, may lisensya yan, at ang pinaka-importante sa lahat, meron po yan alam. Yun yung gustong siguraduhin ng LTO, no? Na mabawasan yung mga kamote riders natin. That is why yung LTO po, no, we also acknowledge yung partnership sa mga riding community, sa mga riders club, meron po dito, may grupo dito. No? Kasi sila yung inaasahan namin na magiging partners natin, no, para lumaganap yung aming kampanya para sa mga quality drivers sa kalsada. Pangalawa po, yung registration natin, we register roadworthy vehicles. Dito po sa Albay, meron na tayong sa Ligao, meron tayong drive-thru na registration. Hindi mo na kailangan bumaba ng sasakyan. Pasok mo dun sa Motor Vehicle Testing Center, no? And then pag ikot nyo po, may window na doon, magbabayad ka, presto, no? Rehistrado na yung sasakyan mo. So meron po tayong ganon. Meron rin naman po the traditional way, and also yung traditional way dating ginagawa natin is mano-mano yung inspection ng sasakyan. Diba? Ngayon, computerized na po. Kung gaano kalakas yung ilaw, gaano kalakas yung preno. Meron na po tayong private motor vehicle inspection centers sa buong Pilipinas. Meron po tayo dito sa Bicol, meron sa Meron tayo sa Ligao, meron sa Pili, Pamplona, and Daet. So yun po, just to make sure na yung hindi kayang gawin ng tao na pag-check sa sasakyan is meron tayong mga equipments na mag-check, na magsasabi kung yung sasakyan roadworthy pa. And later on, sa next slide ko, maiintindihan natin bakit yung LTO in-improve, no, ginawang mas stringent yung process ng pagkuha ng license. Bakit yung LTO mas mahirap na ngayon yung proseso ng pag-i-inspeksyon ng sasakyan? Mas maiintindihan po natin yan sa susunod na slide. And of course, we have the law enforcement, no, where we put order and discipline sa kalsada. And with this, I would like to acknowledge, we would like to acknowledge yung tulong ng aming mga partners. The PNP, no, they're always there with us. No, yung grupo po ng HPG. Yan, nakita ko si Sir Escota nandito, si Sir Salvino. No, okay. Lagi po namin silang kasama. Whenever we go out sa office namin, mag-enforce kami ng batas, no, ang tingin ng tao, andyan na naman yung LTO, pahirap na naman yan, mamimera na naman yan. Akala nila ganun lang yun. Siguro, dahil magpapasko na, kaya nanguhuli yan sa kalsada. Yun yung mga ako, no? New generation LTO employee na ako. My father is a retired LTO chief po. 37 years siya. So, nung panahon nila, wala pang social media. So, itong generation namin, ito yung nilulunok namin. No? Na pag nagsuot ako ng may buaya, as if nire-represent ko na yung opisina. Yun yung ine-erase natin ngayon. Not only with LTO, even other government agencies, yun yung gusto natin. At yun yung mahirap po dun sa side namin ng law enforcement. That's why I would like to commend po yung grupo namin and then yung mga partners namin sa pag-enforce. Because proudly we can say, dito sa Bicol po, walang nangungutong sa kalsada. Kasuhan nyo na ako kung meron. Isama nyo na po ako sa kaso kung meron. Pero wala po ditong nangungutong. No, yung mga sabing, bibigyan mo lang ng kung magkano dyan, sir, pang-snack, hindi po yan pwede sa amin. And actually, nung may sumubok po, no, nung mga nakaraan, may sumubok, nabaliktad. Yung binibigay niya sa amin pang-snack, parang gusto na namin ibigay, allowance niya po para sa pagkain niya sa kulungan. No, that was in Sorsogon. Last year, meron po tayong case na sumubok mag-bribe. So ayun, kinasuhan namin, i-turn over namin sa PNP for filing of appropriate charges. So we put order and discipline. Di ba? Wala pong cashier sa kalsada, kaya hindi kami dapat nangongolekta ng pera sa kalsada. Next, traffic adjudication. This is giving due process po sa lahat. Kung nahuli kayo ng LTO, ng PNP deputized agents po natin, merong prosesong nilatag ang LTO to contest. And para po, mabigyan kayo ng pagkakataon, may paliwanag yung side nyo. Kung sa tingin ninyo may mali dun sa pagkakahuli or hindi totoo yung violation na nilagay sa inyo. So nag-provide po kami ng paraan ng serbisyo para sa inyo. And lastly, yung revenue collection for funding ng mga roadworks po na ginagawa ng DPWH. So if you are not aware, yung collection po namin, yung tinatawag na motor vehicle users charge, majority po ng binabayaran nyo sa rehistro, dyan na pupunta. No? Dina-download po yung budget sa DPWH for maintenance ng kalsada, paggawa po ng mga, nito mga signage, no? Street lights. Yung LTO po nangongolekta ng pondo nun. Tapos sa kanila yung pag-implement ng maintenance ng kalsada. So yun po, ito yung mandato ng LTO. Pero basically, yung batas na nag-govern sa amin, kahit paano natin paikot-ikutin, bumabalik tayo sa road safety. Please, yung next slide please. Babalik at babalik tayo sa road safety. At mas maiintindihan natin yan dito. Nabanggit ito kanina nung previous presenter po natin, si Doktora. Ito yung factors na tinitingnan lagi ng opisina na. Ito yung guide namin, bakit nagkakaroon ng road crash. Something dito sa apat na to, no, may present dyan kung bakit nagkaroon po ng road crash. And pardon me, mas ginagamit ko yung road crash kesa sa aksidente. Kasi ang tingin po namin, ang paninindigan ng opisina namin, ang aksidente, ito yung ginawa mo ang lahat, di ba? preparado ka, maayos ka, may alam ka, nasa kondisyon yung sasakyan mo, maayos yung kalsada, maliwanag naman, mainit naman yung panahon, no? So walang sanang aberya, pero may nangyari pa rin. Aksidente ang tawag namin doon. Nagda-drive ka, may sanga ng puno na naputol dyan, di ba? Bago pa naman yung gulong mo, but for whatever reason, sumabog siya. Hindi naman siya expired. So nagkaroon ng trahedya sa kalsada. We call it accident. Pero for the things na meron tayong magagawa, may control tayo, may participation tayo, ang tawag namin road crash. Mas malaki po yung porsyento nun dun sa ating mga crashes last year, no? Yung road crash. Number 1, the human factor. Number 2, the vehicle. 3, engineering and infrastructure. 4, environment and weather. Pag meron kahit isa dyan na present, recipe na po yan, no? Ano na yan, kumbaga, since DOH ito, symptoms, no? Sintomas na yan na may posibleng aksidente o road crash na mangyayari. Kung puyat yung tao, kung sobrang dami ng problema ng tao, kung may diferensya sa pag-iisip, sa ugali yung tao, possible, no? Magkokos yan ng road crash. Kung luma na yung sasakyan, bulok na yung mga parts, kulang yung ilaw, possible, no? Mag-cause yan ng road crash. Kung bako-bako po yung kalsada or erase na yung mga markings, walang maayos na mga warning sign, walang mga street sign, walang liwanag, paggabi, possible po mag-cause yan ng road crash. Kung maulan, di ba? Kung maulan, kung bigla dyan lumindol, talagang magkukos po yan ng road crash. So we look at these factors. Ito yung mga bagay na karamihan dito, may control tayo, may magagawa tayo. And this is the purpose po ng mga ganitong alliances, to share yung mga resources natin, share ng mga expertise natin, share ng powers natin as a government entity, for one single goal. Ang goal lang naman lagi ng ganitong activities for road crashes is basically to save lives. Buhay naman po lagi ang number 1 na pre-preserve natin dito. And yun yung kampanya po ng LTO since na dumating dito yung aming bagong regional director. Ito yung naging kampanya niya. Ito po yung pinaka-flagship program namin. Sir, yung next slide po. Okay. We call it KSK or Kaligtasan sa Kalsada. Under the umbrella of this KSK, dyan po pumapasok yung lahat ng extracurricular activities namin. Pupunta kami sa mga schools, magkakanda kami ng road safety seminar for elementary, for high school, senior high school, for college. Nung pandemic po, pati webinar, road safety webinar, no? Kinukuha namin yan. Request ng mga opisina ng government natin, no? DPWH, pa-seminar ka sir sa mga driver namin, yung PhilRise, marami po. The Armed Forces of the Philippines, lagi sila nagre-request ng mga training, defensive driving seminar. Kinukuha namin yung mga pagkakataon na yan. Kung makikita nyo lang kung paki-zoom na lang po ng mata ninyo. So, meron tayong ilang pictures dito. Ayan, ito nasa mall, si RD namin yan, no? Sa mall, pumupunta kami. Sa kalsada po, lumalabas kami, hindi lagi para manghuli. Educational lang minsan yung paglabas na tuturuan namin yung driver, no? Information dissemination, may bago tayong batas. And then meron po, ayan, yung aming mga outings nung nakaraan, punta kami sa mga schools, and namimigay rin kami ng token sa kalsada. Ano yung token? Meron dyan mga certificate. Minsan binibigay po yan bilang patunay na sila ay entitled na maka-avail ng free theoretical driving course ng LTO. Pagkukuha ka po kasi ng license, as I have said kanina, requirement yung certificate. Kaya lang, karaniwan pong proseso is a private driving school. May bayad. Ang range niyan, 1,000 up to 5,000 yung presyo ng mga seminar or training sa kanila. No. For theoretical driving course, meron kaming limited slots na binibigay supposedly for indigents or yung mga medyo kapos talaga ngayon. Hindi naman kami mahirap, talagang pobre, Pero ako po sir ay estudyante lang. Ako ay tricycle driver lang. So gusto kong kunan ng lisensya yung anak ko nasa tamang edad na. Kaya lang ang mahal po nung 2,000 na babayaran sa driving school. So lalabas kami, no, nagbibigay kami ng mga grant. Yan po yung nasa picture sa taas na nagbibigay ng mga certificate po. So itong under the Kaligtasan sa Kalsada program, naka-anchor din po yung mga seminar namin dun sa National Program for Theoretical Driving Course na uniform po siyang ini-implement sa buong Pilipinas. Kaya po, ang lahat ng LTO offices dito sa Bicol Region, meron na po kaming established DEC, Drivers Education Center. Lahat po ng LTO sa buong Bicol, meron kami niyan. Diyan gagawin yung mga seminar, andyan yung mga taong naka-assign as instructor na magtuturo, no, sa mga drivers natin at mga aplikante for driver's license. And continuous po yan, walang additional yan na compensation sa amin. That's only additional work, no, pero wala pong problema. Because again, that is part of our commitment para sa road safety campaign natin. Now, we also have yung 3M program po. This is specifically po sa mga drivers, usually mga public utility vehicle drivers. Maginoo, matalino, mahusay. And this is triggered by the fact na, halimbawa dito sa Legazpi, sa Albay, Albay is a known tourist destination. At gusto natin, yung mga turista natin pag sumakay dito ng tricycle, ng jeep, ng taxi, gusto natin magalang, entertaining, maginoo yung mga driver natin. Wala dapat bastos na driver dito sa Albay. Di ba? So, buong Bicol, yun yung kinakampanya natin. At nagkakandak po kami ng seminar para sa kanila. Ang benepisyo naman, meron silang mga privileges po. Binibigyan namin sila ng card. Pag pumunta sila sa mga LTO offices, itong mga 3M drivers natin, we give priority po sa kanila. Magre-renew ng license, sige, prioritize yan kasi 3M driver yan. Even registration ng vehicles nila, priority natin sila kasi 3M driver yan. So yun po yung ilan, no, sa mga ongoing programs ng LTO na patuloy naming ini-enhance. No? Patuloy naming ini-enhance. There was actually this joke. Sana makapture na lang natin. Ayoko na sanang buuhin yung joke. But it goes this way. Hanggang, no, dati ang partner ng LTO, PNP, HPG. Then, nagpartner kami sa mga LGU. Later on, ito na po, with, during the time of President Duterte, with DPWH and DILG. Naalala nyo yung road clearing operations. And then now, with the DOH. And I think ito na yung sagad. This is the best that we can do, no, as a government entity. Kasi ang susunod daw dito, kung hindi pa talaga natin, no, kung walang maging progreso itong kampanya natin, baka ang sunod na partner na ng LTO, St. Peter. Diba? Can you imagine, no, an LTO officer and then yung matitikas nating HPG, tapos merong naka-gray na polo, naka-gray na polo, tapos kami ang tarpaulin namin, kaligtasan sa kalsada. Sila ang tarpaulin nila, yung may white na dove at may ulap-ulap, di ba? Can you imagine kung mangyari na yon? So yun po yung hindi natin papayagan. No, yun yung hindi natin papayagan mangyari. That's why, when we were invited, when we received the letter, automatic po yung action ng director namin. Automatic, hindi pwedeng wala dyan ng LTO. Hindi pwedeng hindi tayo kasali dyan. Dapat nandyan kayo. So, thank you for the invitation po dito and later on darating po si RD. Siya na yung mag-e-express ng mas malalim na commitment namin dito. But kami po sa level namin, no? Sa level namin, mas mababa. Kami yung mga nasa district office. We assure the DOH, we assure this alliance na kami po makikiisa kung ano yung mga programang ilalatag ninyo. We will be very active with this, especially mutual benefit naman. Kayo rin talaga po yung hinahanap namin. Wala lang kaming lakas ng loob kasi wala rin kaming pondo. Okay po? So good morning everyone and thank you for listening and yun po yung LTO Bicol. Good morning.
Ayan, thank you so much, Sir Chris Gerald A. Martinez, Assistant Chief of LTO Ligao. So for the updates and the programs of the Land Transportation Office for their road safety programs. Reminder lang sa ating mga participants, huwag muna tayong aalis kasi may mga surprises tayo dito, may mga ipamimigay kami mga tokens and we will have a games, okay? So moving forward to give us for the road safety program of the PNP Regional Office 5, may we call on Police Lieutenant Colonel Dixon Birango, Assistant Chief of the Regional Operation Division of PNP Police Regional Office, Region 5.
Magandang umaga po sa ating lahat. Kay Doc Vera, sa Provincial Director ng Albay PPO po, Sir Kunanan. Kay Doc Tess Belarma, good morning po sa lahat. Kay Major Escota. So ito po yung PRO 5 statistics on vehicular accidents and safety programs. So bago kasi magkaroon tayo ng safety programs, dapat meron tayong ina-address. Ano ba yung mga vehicular accidents? So next. So ito po yung ating data. Next. So kinuha lang po natin yung from January 1 to April 30, 2022 and January 1 to April 30, 2023. So by province na po ito. So this Public Safety Index, pag sinabi nating Public Safety Index, ang involved po dito ay road crashes or yung vehicular accidents. So, next. So, kung makita po natin, from January to April of 2022 versus 2023, tumaas na po agad ng 634 accidents or 24.52%. Yung 84 accidents dyan ay reckless imprudence resulting to homicide. Yung 1,373 ay physical injury, RIR, resulting to physical injury. And yung 1,762 ay damage to property. So yan po ang mga aksidenteng nangyayari. Next. So, RIR by province. So makikita po natin yung data and yung average monthly incidents sa buong region. So marami-rami po ang namamatay sa road crashes. And physical injury, mas marami, lalo na ang damage to property. Next. And medyo bumaba ang ating crime clearance ngayon kasi yung ibang involved sa accident ay hindi pa nakaka-report sa police station dahil yung iba ay nagpapagaling pa and yung iba ay hindi pa makapag-decide kung sila ay magpa-file ng kaso o hindi. So magiging 100% yan kung ang lahat ng involved sa vehicular accidents o road crashes ay nakapag-settle or na-filean ng kaso yung mga may kasalanan base sa investigasyon ng ating kapulisan. So, tataas po yan kung may mga filed cases na, meron silang amicable settlement, or isang makaka-apekto dyan kung self-incurred accident yung nangyari. Next. So, ito po ang ginagawa ng Police Regional Office 5 sa road safety. Next. So, dahil nandito po tayo sa Albay, karamihan ng mga pictures natin dito ay kinuha natin sa Albay. So we intensify the enforcement of laws and ordinances. So meron tayong ini-implement ngayon dito sa Albay, yung programa ni Sir Cunana, ng ating Provincial Director, yung mabagal na sasakyan manatili sa kanan. So tuloy-tuloy po ang pag-implement ng ating kapulisan sa Albay para maiwasan din ang mga aksidente. So marami kasi ang mga nagmumotor, hindi naman lahat, na bigla na lang susulpot. So yun ang mga nakaka-contribute ng mga aksidente o road crashes. Next. So we also strengthen the implementation of traffic management. So kulang lang yan sa picture, pati yung mga road blocking, sabi nga kanina ni Sir from LTO, kasama ang road condition. So may mga road reblocking dyan na lalo na pag mga holidays, mga maraming tao na lumalabas, pinapa-check namin yan sa aming mga personnel at kailangan yan ay malagyan ng mga traffic personnel. Next. And community engagement. So nagdi-distribute tayo ng mga flyers to avoid traffic accidents. And yun nga, pinupuntahan natin yung mga paaralan din katulad ni LTO para turuan ang mga kabataan, yung mga estudyante from elementary to high school, kung paano din gamitin ang kalsada at paano maiwasan ang mga aksidente. Next. So, road safety trainings and seminar. Yung bawat probinsya naman ay nagde-deputize at pinapa-implement yung kanilang ordinances, and yung LTO ay dinedeputize din tayo sa pag-implement ng Republic Act 4136, and nagtitrain din sa aming mga personnel yung highway patrol doon sa road safety and driving yung sa driving motorcycle. Next. So yun nga, during Sumbak, summer vacation, may mga linalagay tayong mga motorist assistance center along the national roads para makapagbigay ng assistance sa mga motorista na dumadaan sa ating lugar. Together with the force multiplier. So nandyan yung iba-ibang mga people's organizations, NGOs, para tulungan tayo sa pag-implement ng traffic laws and ordinances and pati sa kaligtasan ng ating mga kababayan. Next. So, nagre-recommend din tayo sa Peace and Order Council base sa ating mga rekomendasyon and analysis kung ano ang dapat na gawing ordinansa and tungkol sa paglagay ng mga road signage para sa ayos yung mga nakikitang problema at ma-address yung mga concerns. Next. And ginagamit natin din ang TRIMP, yung radyo, yung media, para may palaganap ang mga programa ng PNP tungkol sa road safety and iba pang criminality na nangyayari sa kalsada. Next. So, ginagamit din natin yung social media card kasi mas marami na din ang gumagamit ng social media para palakas ang ating kampanya sa road safety. Next. So we collaborate with the national government agencies. Kasama na po dyan yung DepEd, yung LTO, the DOH, para ma-implement natin yung mga batas sa kalsada and for the safety of the general public. Next please. So tanda natin, masakit sa katawan ang aksidente. Accident hurts. Pag nag-observe tayo ng safety, mas ligtas ang ating katawan. So yun lang po sa lahat. Diyos mabalos po sa Satuyaga po.
Maraming salamat, Sir Police Lieutenant Colonel Dixon Birango, our Assistant Chief of the Regional Operation Division of the PNP Police Regional Office 5. Ayan, so may mga learnings na naman tayo, panibagong updates sa programs na ginagawa din ng ating counterpart from the PNP Regional Office 5 for their road safety programs. Again, thank you so much, Police Lieutenant Colonel Dixon Birango. Thank you, sir. Okay, ladies and gentlemen, moving forward, magkakaroon tayo ng games. So, may I request any representatives from the different participants or contingents from one rider, at least 2 pairs.
2 pairs from
We need 5
groups.
pairs.
Yes. Alam niyo po ba ang Pinoy Henyo? So,
Volunteer na lang,
ayan.
sir, ma'am. From One Rider Philippines. Then from Steve, also from yes,
yeah. Sige po.
from PNP also, ma'am.
Habang po nagla-lunch yung iba, so 2 volunteers
Nagla-lunch
po.
sila eh.
Oo nga. Sige na po, may prize po ito.
Bababa ako, Hayes. Ha?
Okay,
Bababa ako.
sige.
Kukuha ko ng isturbin natin muna sila. Yan, dito ako sa One Rider Philippines. Male or female, at least 1 pair. Any volunteer po? Okay, 1. Next, sir. Yan, sige, proceed po kayo doon sa taas, sa stage. Icebreaker muna
So,
tayo,
may 1
guys.
pair na from one rider.
Map dito, sa table na to, from
Team Region.
BRHMC. Sige. Ma'am, pwede po
Team
dalawa?
CHD. 2 pairs.
2 pair. Sige po.
Okay, we have
Dito,
pairs.
anong group kayo? Ayan, United Cyclists of Albay. Istorbuhin muna natin. Mabilisan lang yan.
UCAP. Sige po.
May papremyo tayo dyan. Nakita niyo yung motor doon? Hindi po yun, hindi po yun. Sinabi ko lang, kung nakita niyo yung motor, pero hindi po yun yung premyo. Okay? So we have 3 pairs na. Dito sa... Ito, from the PGA. Sige. Okay lang yan.
Sige po,
Mas
akyat
magandang
na yung-
busog. Volunteer from the youth. Okay,
Okay.
sige. Isa
We
pa.
have 1, 2, 3,
Sige na.
4 pairs. So, isa na lang. Isang pair na
Dalawa
lang
kang
po.
pair. 1, 2... meron na. 1, 2, 3, 4. Isang pair na lang.
1 pair na lang po.
Okay, go. Ayan. Ano yung mechanics natin, Hayes?
Okay. So, we will be having a game. So, Pinoy Henyo with road sign. So, ito po yung mechanics. So, sige po, pwede nyo naman po basahin. Each pair will have a guesser and instructor. So, isang magigess, isang instructor. Each pair shall be given 3 images of road signs and will be flashed behind the guesser. The guesser shall only have 30 seconds to guess the road signs behind them. So, 30 seconds lang po. Dapat mag-guess nyo yun. The instructor can only answer questions with yes and no. Okay? So, disqualify tayo kapag sinagot nyo talaga yung sagot. So, yes
Okay,
or no
move
lang.
forward tayo dito, sir.
The
Dito
least-
tayo, ma'am.
Okay. Number
Sige.
5, the least team spent in guessing shall be considered the overall winner. So, yung pinakamabilis po na makahula, yun na po yung panalo. Sige.
Okay, interviewin ko muna to, Hayes. So, from
BRHMC.
okay, BRHMC. So, madam? Pangalan po?
Elaine po. Elaine.
Ma'am Elaine and Sir?
Luis.
Sir Luis. So, nanonood kayo ng Pinoy Henyo. So, nakapag-usap na kayo sino yung magiging yung guest, magiging mag-guest sa inyo, and then yung magiging instructor. So, okay na? So, ready na po yung natin? So, ito muna ang first player or itong pair muna. Tama. Okay. Sino yung harap doon dapat? Yung magi-guess. Ikaw po? Guesser ka. O, ma'am, dito ka. Harap ka po sa audio. Huwag kang talikod na. Huwag kang titingin dito sa may LED wall. Doon ka, sir. flash ngayon dito sa LED. Ikaw siya yung mag-guess. Yes or no, 30 seconds lang ang bibigay sa inyo. So, yung pinaka-lowest time na makakuha ng 3 scores, magiging winner po. 30 seconds. Ready? I-flash na po natin, ma'am. Sir. Okay, ready? Go. Yes or no lang? Yes, pwede, oo. Hindi, pwede, ganyan. Okay, go! Road signs. Guess. Mag-guess ka, ma'am.
Stop. Ano ba?
Yes, no lang. Titingnan mo yon yung, di ba? Signs na yan, traffic signs yan, mag-guess siya, sasagutin mo siya, yes or no. Hindi mo alam yung signs, pati tayo dyan. Pati niya alam yung signs. May driver's license ka, sir? Wala. Buti na lang wala. Kasi kung mayroon kang license, hindi mo alam yung traffic signs na yan. Okay, next na lang, next. Tama? Next, proceed tayo. Ha? Hindi kayo licensed driver? O any guess?
One way.
One?
No left turn.
Ha?
No left turn. No, ano ba, Dick?
Okay na yung time? Okay na, time's up. Okay, next player. Sorry. Try again.
Okay.
Yung kayong dalawa, sir. Recall na niya, tandaan niya na yung mga traffic signs, ha? Sino yung mag-guess?
Okay, next player.
Pangalan mo, sir?
Mark Vincent Espinas po.
Mark Vincent from?
Pandandaraga.
Bagtang Daraga. Ikaw, sir?
Justin David Ramirez po.
May license na kayo? Wala pa. So, anyway, give a shot. Try nyo na lang.
Mga cyclist ata ito.
Okay? Yes, no, pwede.
Okay.
Ano?
Timer starts
Now,
now.
go. Guess. Mag-guess ka ng traffic signs.
Traffic lights. Stop sign.
Up. Okay, one point. Sige, next.
Okay, 15 seconds. Next.
Pedestrian lane. Crossing.
Guess pa, sir. Go, Vincent. Go, Vincent.
Okay, 15 seconds. Ten, 9, 8, 7, 6, 5, 4, 2, 1. Okay.
Time's up. 1 point kayo.
Another
Next
one.
players. Next player.
So,
may cheerer kayo.
15
Ay, ito
seconds
sigurado to.
against
Magtatap to.
Miranda.
One rider, to. So, malamang talagang
Okay, for the third player.
Are we ready?
Sige, beat niyo po yung 15 seconds.
Pangalan mo, sir?
Jeffrey po.
John?
Jeffrey.
Ikaw, sir?
Unique Moto, ma'am.
Unique? Moto. Unique talagang pangalan mo. Okay, go.
Okay.
Timer starts
Now.
now. Go.
Bicycle A.
Last 10 seconds.
Next.
Wala.
Okay, next.
Ano na tayo?
Ano po yan? Sige,
Next ulit,
go,
next.
kaya niyo yan. Last 15 seconds. Up, yung bibig.
Next. Kayo pa?
5 seconds.
5 seconds.
2, 1, okay.
Hindi. Okay, next player.
Next player, please. So, pang ilan na to? Pang-apat. Pang-apat.
Pang fourth player, kayo sir.
Sige po.
Instruct mo yung partner mo, turuan mo siya, magbigay ka ng sign language, kung ano.
From ano po kayo?
Pangalan, sir?
Ayan.
J-roll po.
J-roll. Ikaw?
Rome Navera po.
Anong nire-represent yung group? Ha? Cyclist? Okay. Yukap Kamalig. Okay, go! Yan. Ayusin mo, sir, ang ano mo, sign language mo, body language mo, mga ganyan.
Ano yun?
Mga ganyan. Mga ganyan. Oh.
10 seconds.
No you...
Ano yan?
No left right. No U-turn.
No. Okay, finish na po. Next.
Sayang.
Okay.
Next, sige, go.
Another, go.
Sige, another try.
Isa pa.
Isa pa, sige.
Pedestrian lane. Ano yun?
Speechless, sir.
School zone.
Change ano?
Pedestrian.
Next.
Left turn.
Louder.
No left turn.
Sige po. Kaya niyo yan.
No right turn. Right turn.
Sige, malapit na. Ano yun? Ano yung sabi niya?
No right turn?
No right turn.
Tama ba?
Tama.
1 point.
So, 20
Pasok.
seconds. Na-reach niya in 10 seconds.
Okay.
Yes, no right turn.
Correct. Okay.
Okay, sige po.
Okay, next
Next
player.
pair po. So, ibibit natin yung 10 seconds.
Ay, okay na?
Wala.
May last pair pa tayo.
Yes. So, good luck, sir.
Good luck. Ayun sus mga matindi eh. Sir. Pangalan nga ni sir?
Jericho po.
Jericho. Kit from PGA. Okay, go!
Okay.
Yan.
Start.
Parking lane.
No.
Check mo.
No parking. Parking lane.
Parking.
Parking
Tama.
lot.
Parking lot. Parking lane.
Okay, next na po tayo.
Next. Yan.
Two-way lane. Two-way lane. Left and right lane. Two-way.
Two-way lane. Pasok.
Okay na po.
Okay, ilang oras? Ilang seconds?
Sige. 16 seconds.
16 seconds. Yung nauna.
Yung nauna, 15.
Sino yung winner?
Yung 10.
Yung 10, di ba yung 10? Sino yung 10 seconds?
Yung pang yung no right turn. Yung pang-apat.
Pang-apat na pair. Sino yun? Yan sila. Congratulations.
Sir, so we have a winner. So nakuha po nila in 10 seconds. Sa yung no right turn sign. Okay.
Ayan, so realization dun, Doc, mga ma'am, sir. Talagang kailangan natin familiarize yung traffic signs.
Actually,
Mga informative, mga no parking, no entry, no crossing, mga ganyan.
Actually, kahit ako nahirapan dun.
Mahirap din talaga. Anyway, congratulations sa kanilang dalawa sa nanalo. Paki-coordinate na lang po dun sa ating for the tokens. Ayan.
So, for our next activity po, we will have a short message from the Provincial Director of Albay, PPO, Police Colonel Fernando L. Cunanan Jr. to discuss about the road safety programs of Albay PPO.
Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety.
To our guests who are properly introduced by our keynote speaker and our good governor, Governor Grex Lagman. Sa mga organizers po ng event na ito at sa mga nagsidalo, magandang umaga po sa ating lahat. Magandang umaga po sa ating lahat. Medyo gutom na po tayo, no? Anyway, we are gathered here today to discuss an issue that affects each and every one of us. That is, of course, road safety. Na-mention po ng ating mga nauna sa akin na every year, thousands of people lost their lives or suffer serious injuries due to road accidents. This is a problem that requires a holistic approach, and I am proud to say that the Albay Police Provincial Office has stepped up to the plate of our program, which is kaayusan sa daan, mabagal na sasakyan, manatili sa kanan, which is complemented by the 3 E's of traffic management, which is education, engineering, and enforcement. Pero habang nagsasalita po kanina si LTO, napansin ko, habang nakaupo ako, inedit ko yung speech ko, dinagdagan ko ng isang E, and you will know it later. First E is education. Education plays a fundamental role in the fight against road accidents. The Land Transportation Office has taken the lead in educating drivers, pedestrians, and cyclists on the importance of road safety through various campaign and programs. Nakita naman po natin kanina, napakaganda po ng mga programa ng ating LTO. The LTO's effort in promoting responsible driving and road safety awareness are integral components of the government's effort to reduce road accidents. And their consequences, marami sa atin na kapag nandun po sa LTO, no? Taas po kami dito, yung mga may lisensya. Yung mga may lisensya po, taas kamay. Maraming walang lisensya pa. Kapag kumukuha po tayo ng lisensya, nandun tayo sa kwarto ng LTO, napakabait natin. Lalo na pag mag-exam na tayo, di ba? Napakabait natin. Lahat sinusunod natin, lahat ng instruction sinusunod natin. Pero once na nabigay na yung lisensya natin, andun tayo, broom! Ano na? Eat my dust! Mamaya, kasama ka na sa statistics. Di po ba? Second E is engineering. Engineering is another crucial aspect of road safety. The Department of Public Works and Highways has been tasked to designing and constructing safer roads, bridges, and other infrastructure, to include, of course, safety, warning, and signages. The DPWH effort in implementing traffic engineering solutions are important in reducing accidents, road accidents, and their severity. Yung ano po no, yung ang sarap mong nagda-drive, nakikinig ka sa magandang music, and then bigla-bigla makarating ka sa surface of the moon, no? Or sometimes worse is nagda-drive ka, bigla mo makita yung poste ni Aleco nasa gitna ng kalsada. Ayun, ang mangyari, magiging part ka na ng statistics. Finally, third is enforcement. Enforcement is the third E of traffic management and is essential in ensuring the laws and regulations that are being followed. The police, LTO, and other traffic enforcement agencies of the local government have the responsibility of enforcing traffic laws, apprehending violators, and conducting road safety operations. Their efforts are crucial in reducing the number of accidents in our roads. This last E of traffic management, however, made me think on how many drivers have we canceled their licenses for being recidivists. Some of our provincial traffic enforcers made mention about personalities na suki na nila sa mga hulian sa kalsada. Parang di ata po nila binabayaran yung kanilang mga penalties. So, last month, I requested, made a request, written request kay Governor, attention, Doc Cedric, to give me a list of recidivist traffic violators. Asan na po kaya yung request ko na yon? Mayroon po ba dito? Somebody from the PGA? So, with that list, we will endorse it to the LTO. Ano po kaya pwede natin gawin doon, no? Sa mga recidivist na violators na makakommit ng 5-10 violation? Eh, kung wala po, nahirapan po ata sila dahil it takes how many months na, baka wala silang database na nakalagay kung ilang violation na per driver ang meron. Kung wala po, ang Albay Provincial Police Office is handa pong makipagtulungan sa inyo para sa database po na ito. Of course, provided ibigay niyo po sa amin ng equipment to monitor these recidivist drivers. So, as I mentioned a while ago, dapat baguhin na itong 3 E's of traffic management. At gawin ng 4 E's. Para yung E, ilagay po natin para sa DOH. Yun po yung tinatawag nating emergency. Lahat po ginawa na natin. So, bandang huli, emergency nga, sabi nga, masakit ang maaksidente. So, millions have died because of road accident. At kanina, habang minimension po ni DOH and LTO, yung St. Peter, naalala ko, when I visited, when I made a visit in Texas, USA, nakita ko doon, sabi niya, go ahead, drive recklessly. We will take care of your family. Dapat sir, ganyan na hata yung mga signages na nilalagay natin no? So, and then sabi nga kanina may ulap-ulap, may kalapati. Anyways, traffic enforcement, for your information, ay matagal na pong na-devolve down to the LGUs. So, kapag may traffic po sa kalsada, wag po nating sisihin si police. Minsan kasi, sino pong gumagamit ng Waze dito? Waze. Ako po, dinilit ko na, in-install ko na si Waze. Kasi pag nagdadrive po ako, nakikita puro may police. Parang lahat kasalanan ni police. Nagpunta nga si police, nag-render ng assistance, tapos makikita doon, picture ni police doon sa Waze. Sino pong gumagamit pa ng Waze sa inyo? Palaging kontrabida si police doon So, kaya tugol, nag-enforce na si police, siya pa may kasalanan. So when I assumed office last September, last year, I noticed that the vehicular accidents are the highest in crime incidents. So I came up to the program of ayusan sa daan, mabagal na sasakyan, manatili sa kanan. A program by the Albay Police Provincial Office combined with the government holistic approach on the implementation of 3 E's. Dahil, ano po yun? nakipag-meeting ako sa LTO, sa DPWH, and other government agencies para po sama-sama kami doon mag-implement ng kaayusan sa daan. So, it was a significant step towards a safer roads and reducing the number of injuries and fatalities caused by road accidents. However, we must remember that the fight against road accident requires a collective effort from all of us. As drivers, we must prioritize the safety and follow traffic rules and regulations at all times. As pedestrians and cyclists, we must be vigilant and cautious when crossing the road, of course. As a community, we must raise awareness about the importance of road safety and support our initiative, the Kaayusan sa Daan, mabagal na sasakyan mantili sa kanan. In conclusion, the government's holistic approach of the 3 E's of traffic management and the Albay Police Provincial Office are important steps towards reducing the number of road accidents, injuries, and fatalities. However, we must all do our part in ensuring road safety by being responsible and vigilant on the road. Of course, let us work together to make our road safer for ourselves and for our future generations. So nakikiusap po ako sa ating lahat na nagsidalo ngayon na sana'y maging maingat sa kalsada at sumunod sa mga traffic laws and regulations para hindi tayo maging part ng statistics. Magandang umaga po sa ating lahat.
Hello, thank you so much, Police Colonel Fernando Cunanan Jr. for that inspiring message. Moving forward, yes? Okay, so we will have a visual video presentation. So please watch this video.
The Buhay Ingatan Droga AA1 or VIPA program is an anti-illegal drugs campaign project which was launched nationwide by the Department of the Interior. VIPA Police Provincial Office, headed by its dynamic Provincial Director, Police Colonel Fernando Lacson Cunanan Jr., in its aim to instill discipline among the drivers and the road users and intensify the implementation of the traffic laws and local ordinances and traffic concerns in the province of Albay towards the attainment of an orderly, safe, and progressive community, has initiated a program dubbed as Kaayusan sa Daan, Mabagal na Sasakyan, Manatili sa Kanan. Said project was formally launched last October 27, 2022 at the Legazpi City Convention Center, Legazpi City. Duly participated by the local government officials, the heads of the different government agencies, members of the transport sector, media, and stakeholders. The crafting of said program is a result of a thorough review on the vehicular accident cases in the province and the relentless disobedience of some road users to the traffic laws and ordinances that commonly causes loss of lives and properties. Review of the data on the traffic accidents revealed that a total of 399 reckless imprudence resulting in homicide, 5,468 reckless imprudence resulting in physical injury, 8,766 reckless imprudence resulting in damage to property had been recorded by this unit from 2018 to May 15 of this year. Albay PPO, in its desire to address the increasing number of traffic incidents and violations of traffic laws and ordinances, has revisited the various laws governing the traffic concerns, such as the Republic Act 4136 or Land Transportation and Traffic Code. LTO Memorandum Circular Number 2021-2267, DILG Memorandum Circular Number 2022-036, Provincial Ordinances Number 001-2020, 0012-2020, and 99-009, or the Provincial Traffic Code of Albay, which pave way for the effective and efficient implementation of the program. Since its implementation last November 14, 2022 to date, it has been observed that the traffic accidents involving slow-moving vehicles has decreased, and the revenue from the implementation of the traffic laws and ordinances through the T.H.I.N.K program has drastically increased. Shown on the screen are the accomplishments of the Highway Enforcement Patrol Task Group Albay through Kaayusan sa Daan, Mabagal na Sasakyan, Manatili sa Kanan program from November 14, 2022 to May 15 of this year. To ensure the competency